Good morning, everybody. This is the first meeting of 2022 of the People and Health Scrutiny Committee. Welcome to all the members who are on the call, all members of the public and all officers. And thank you very much for coming. If I can do a roll call of our members who should be on the committee at the moment. Could you just confirm that you're there, please? Councillor Rennie?
Yes, I'm here. Good morning, everybody.
Thank you. Councillor Brown, are you here?
Morning, Chair.
Good morning. Good to see you. Councillor Gorringe.
Morning, Chair. Present.
Good morning. Councillor Ireland.
Present, Chairman.
Thank you. Councillor Legg.
I'm here too.
Councillor O'Leary.
Present, Chairman.
Thank you. Councillor Penfold.
Good morning, Chairman.
Good morning. Councillor Pipe.
Morning, Chairman. Morning, everybody.
Good morning. And I think Councillor Turner has sent an apology, but can I just check he's not there? Okay. If Councillor Turner could be recorded as an apology, please. We have a number of officers in the meeting with us today. If I could ask officers when I go to them to present, if they could identify themselves and let the public know who they are and what their position is, please. That would be really useful, rather than me going through a long list of people at the moment. And thank you all for attending. Right, I have the standard statement to make about this committee because we are working online. In consultation with group leaders, the Chief Executive has exercised his delegated powers to revert to virtual informal meetings of council committees, reflecting the emergency of Omicron and the rise of COVID cases locally. In order to protect our elected members, the staff and the public, and to be able to carry out the business of the council. Members are advised that where a decision was required, the appropriate corporate director would be the responsible individual to make the decision, whilst considering the views expressed by the wider committee membership. The reports on today's agenda are for review by the committee, to seek comments from the committee and support for the direction of future work, and also provide the committee with information to determine if any additional areas should be added to the forward plan for further review. So that concludes. I think this will probably be the last one in this present session of online meetings. I'm hoping that we can go back to face-to-face for the next meeting, but I will confirm that. I just wanted to make a couple of really brief announcements. The first one I would like to say is that our committee clerk, Fiona, is leaving the council shortly, and I'd just like to publicly thank her for all the work that she's done for this committee over the time that I've been chair of it. She'll be greatly missed. And I would also like to welcome George, who will be our new committee clerk. My other announcement is about the generality of this meeting. I think this meeting could be quite contentious, particularly because of the amount that we've got on it on about care sufficiency, the Home First and areas surrounding that. I think members, could I ask you at the outset not to bring up any personal issues, any residence issues? We need to keep this meeting on a general basis. If you've got any individual issues that you need to bring up with officers, please take them directly to officers. But I will not be accepting any comments about individual cases that you may be dealing with. Thank you, committee. Could I also remind you to keep your cameras off and your microphones muted until you are invited to speak, and as always we'll have the RTS into the chat bar, and for the members of the public, RTS is just right to speak, so there should be very little chatter within the confidential part of what is in our chat bar. Right, could I ask for apologies, please?
apologies from Dal Turner, Chairman.
Thank you very much, Fiona. Declarations of interest. Are there any members who would like to make a declaration of interest at the moment? That's very quiet.
Yes, sorry, it's Councillor Brown. Sorry, I was trying to take myself off mute. I should probably declare all my usual, just in case. So, well, I have a daughter who's working as a junior doctor in DCH. I have another daughter who works for the NHS Confederation in a senior role, and my wife is a matron at Yeovil District Hospital. And I'm also the governor, a partner governor of Dorset Healthcare.
Thank you very much, Councillor Ireland. Are there any other declarations of interest?
Chairman, could I just make a point? I'm not sure that it's a declaration of interest or it's relevant, but I'll mention it. I do have a son who's disabled.
Okay, thank you very much.
He doesn't live with me.
Okay. Thank you very much, Councillor Penfold.
Chairman, I'm sorry, it's Jonathan Mayer, the monitoring officer. Could I just go back to Councillor Ireland, please, and just establish what sort of declaration he was making? Was he disclosing? I don't think the items he mentioned are disclosable pecuniary interests, but just to have some clarity around that, because it does affect participation in the meeting. Thank you.
Yeah, they're not pecuniary. It's just that I have relatives working in the local NHS, essentially.
Thank you.
Okay, Jonathan. Okay, thank you very much.
Thank you.
If anybody comes across a declaration that they think they should have made earlier on during the meeting, please don't hesitate and let me know, and we can get that recorded. Public participation. Do we have any questions from the members of the public?
No, Chairman, no questions or statements.
Okay, thank you very much. Questions from members. Have we got any written questions, or are there any questions?
No written questions have been received.
Okay, thank you very much. Right, so we're on to our first item, which is Home First and Adult Care Market Sufficiency. We have two papers as part of this, which is the Home First one, which is from our health colleagues. Unfortunately, due to illness, we haven't got anybody here to present to this paper. So I think if we can have a really brief discussion, bearing in mind there's nobody to answer questions on it, but we have got this coming to our agenda in March. So if there are questions that can be taken forward for that, I would want an update on this paper for March and then bring it back. Are there any questions anybody would like answered that can be included in the March paper, please?
Yes, could I ask a question, please, Jill?
Yes, it's Councillor Legg. Yep.
As you're saying, this is a paper where there isn't any person from the health authority to answer. I think it's on page 7. Let me just have a quick look. There's some bullet points on page 7 where they talk about investment in additional short-term home and bedded care. Are they talking about bedded care just within the health authority, or are they talking about bedded care which might be elsewhere? The reason I ask is that there was a trial which I think has been extended in relation to provision for people who've had strokes within Dorset to be given some convalescent period in the Etman Hospital in Sherborne, and that trial's been extended into March. And I just wondered whether that they were talking about bedded care within just hospitals, non-acute hospitals, or whether they were talking about bedded care elsewhere.
Okay, I don't know whether any of our officers can pick that one up, or
Councillor Taylor, I'm happy to respond to that in part, if that's okay.
Thank you.
Thank you, Councillor Legg. So there is both the investment in additional bedded capacity is both in acute, non-acute community hospital and in capacity within the independent provider market, so nursing and residential provision within those bullet points.
Okay. But
Okay.
to be continued when we have an appearance in March at our next meeting, perhaps.
Okay, we'll make that. We'll put that onto the agenda for that. Councillor O'Leary.
Yes, thank you, Chairman. The only question I had was when are DC preparing for the implementation of ASC reforms? That's the only one I had to ask.
Okay, it looks like Leslie is coming in on this one.
Yes, would you like me to answer that one?
Yes, please.
Thank you. So hello everybody, my name is Leslie Hutchinson and I'm the Corporate Director for Adult Commissioning with Dorset Council. In terms of the adult social care reforms, and it is a timely question, thank you very much for asking that. You will see in the market sufficiency report that there's been a plethora of new pieces of guidance that have come in, some of which link very closely in with the adult social care reforms that were published earlier on in the year. As a local authority, we've got a small task and finish group looking at the adult social care reforms, and we hope to bring a paper back to this committee or the overview committee discussing what we're going to be doing. We're also working with colleagues in the Southwest to look at what we can do jointly, and we're also working closely with the Department for Health and Social Care on a number of the factors that are coming up in the reforms. So one of the things that you'll see is that there's a requirement now to do cost of care exercises and to publish those. We're already underway with that and have got those in place, and I'll be talking a little bit more about those later in the report. The other position, which I'm sure most people are interested in, is around the care cap and the bringing in of the rising of the care charge level, and we're looking at that now. There is pilot groups across the country that are running that are looking at the number of staffing that are needed to be able to implement those, and as soon as the Department for Health and Social Care have concluded that work, then they will be sharing that with us and we'll be looking at that in detail. We are doing a particular piece of work with the department around looking at the housing element, and we've got a further meeting to discuss that with them. Because at the moment, none of the guidance is quite clear about how all of the reforms are going to be implemented, and the conversations do keep changing frequently. But we are talking to the department about that, as we are about the cost of care exercises I mentioned earlier. And then finally, what I would like to say is the digital aspect for those reforms is moving at quite significant pace and is very developed, and we're waiting now for online tools to be shared with us. So we are looking at everything that we need to do for those reforms, and we've got the task group in place, and we can keep coming back to you with further information as we have it.
Is that okay, Councillor O'Leary?
Yes, thank you very much.
Okay, Councillor Ireland.
Yeah, it's just two quick things on page 9. If I bring it up in front of me, I should have two screens really. It basically says the overall rate of discharge has been in continual decline across all pathways over recent months. So it sort of suggests that a large proportion of the system isn't working. You know, it was introduced in COVID, so it's trying to react to that, and it doesn't seem to be working. And I was also hoping to ask some questions on the what they called tactical opportunities. There's a whole list of 8 of them. They're all a bit woolly, but if we haven't got anybody here to answer them, I guess we'll have to leave it till next time. Anyway, yeah.
Okay, do you want to send your questions in, and I can make sure they'll get answered for the next paper, for the next time it comes, or do you want to just hang on to them?
I'll probably hang on to them. A lot of them are just, they seem like management speak and don't actually, it's difficult to understand what they actually mean. And some of them like training. So why is that an opportunity? Why aren't we doing that already? I'm confused. So.
I must admit, I find a lot of this, they use acronyms that I have to literally Google to try and find out what they are. And I think when they do bring it back, a table of acronyms would be really useful. Councillor Wolf.
Thank you, Councillor Taylor. Two things. One is I do know that the Director of Public Health, Sam Crowe, has, like me, contracted COVID, so that may explain why he isn't here, and I've only just found that out. The second thing is that in Leslie's presentation on the next item, Leslie Hutchinson, the Director of Corporate Commissioning, she will be talking about what we can do to try and encourage hospital discharge in a more timely manner. Obviously, it's not our direct responsibility, but there is something that we, both as an organisation and members, can do, and we'll be talking about that in some detail. So I'm grateful for the question, and whilst we won't be able to answer it in total, we will be able to give some views as to how we can contribute towards ameliorating this crisis. Thank you very much.
Okay, thank you very much, Councillor Wolf, and hope you managed to stay for the meeting and you're not feeling too bad today. I've got a few questions on this paper, which I would like picked up on the March paper. When we started doing Home First, I think we've had it regularly on this agenda. It was very much around the getting people discharged from hospital in a timely manner, but it was also about preventing admissions and trying to go back to what we did have when we had peaks in the winter and then it quietened down during the summer, which doesn't seem to be happening at the moment, and looking at the amount of non-elective that we have got that are, I wouldn't say causing a problem because that is really disrespectful to people, but more people being admitted to hospital than we should need to. And part of the Home First was all about the prevention agenda. Now, when we've had paper in the past on this, we've had quite a lot about the prevention agenda, and there's very little in this one. So if we could, on the forthcoming paper in March, if we could have some information on the prevention side of it and how we're doing on that, how we're meeting the targets that we set, must be a year, 18 months ago for the Home First programme, and whether we need to reconsider how we do in this. If you could take that one, please, that would be really useful. Are there any other questions on this paper?
We've got nobody with an outstanding RTS, Jill.
Okay, that's super.
Jill, can I just ask, in terms of making sure that we have a productive discussion in March, who should we send our questions to in advance? I mean, if there's some points that I want to pick up on this particular paper, do I send them to you? If Fiona's going, who do I now send these questions to?
Right, I think our new committee clerk is George Dare. I think if you could send them to him and also copy me in, but if they could be done in a timely manner, they will need obviously to go to our health colleagues, but I will make sure that they are addressed. And I think, to be quite honest, if all of us can look at putting in questions ahead, it does give officers a chance to give us a more full and detailed response to them. So yeah, please just forward your questions in before the meeting, please, if possible. Okay, let's move on to the next agenda item, which I think is going to be quite lively, which is the update on market sufficiency and the impact of COVID-19. If for this I can pass over to Leslie to give us a brief resume of the paper and where we are now, because obviously these papers were written a couple of weeks ago, and to see where we go from there. Thank you very much.
Chairman, is it okay if I make a short introduction before I hand over to Leslie?
Yes, you can do.
Thank you very much. Members, this came before you in November, this original paper, and you asked that it be presented back to you in more detail and a progress report on where we were at your next meeting. So this is an update on the November report, but it does actually talk in quite some depth about the impact of the Omicron variant, which at that time was not known of, and also the impact of the overall national picture, what we've done, what we've got in place. Can I make the point that I've been through this presentation with Leslie? It is incredibly detailed. There is a huge amount of information there. You will, of course, get a copy. It is my view that it would be better for questions to wait till the end, because there's quite a lot of connected detail, and I think it will just be much easier to have the questions at the end, but that's entirely up to you, Chair. The second thing is that at the end I intend to talk about what I think the council can do and what you can do as members, but I'm also looking for you to give any ideas to us as to how we can move this forward. So I view this as a very much a two-way exercise. So I'm very keen that if you've got any thoughts or ideas, you either bring them up today or you relate them to us at a later time. That's absolutely no problem. So this is not just a one-way conversation as far as I'm concerned. So please do think about what we're talking about and make any suggestions and come back to us. But as I said, it is a very detailed presentation, and can I just say thank you to the staff, because believe you me, the directors are working days, evenings and weekends to manage the situation, which has not got any better in many cases. So this report, you will find some good aspects and some aspects that are quite depressing. This is part of a general national picture, of which we are not immune, but what we can do is talk about what we're doing and what we're going to do. So I think there is some positive news, but there is some quite concerning news, because the situation is nationally in something of a crisis, and Leslie will talk about that, but we are managing it as best we can, but we're always willing to learn and listen to any suggestions you may have. Thank you, Chairman. I'll hand over to Leslie through you, if I may.
Thank you. If you'd like to take over, Leslie.
Thank you very much. So thank you for inviting us to present this report. My colleague Steve Beavers, who's just been on the call as well, who's on the screen as well, is going to be driving the presentation for me. So I'll often be referencing Steve and saying, please, can you move it on? So yes, this is an update on our market sufficiency from the November paper that we shared with you. And Steve, if you could move me on to the next slide, please. And what we're going to be covering throughout this is, one is an update, and just by way of a really quick introduction in terms of that update, Councillor Wolf is correct in what he was absolutely saying. We've seen an improvement in terms of the sufficiency we've got around support for adults with working age. Our home care hours have seemed to remain pretty stable. And they could have deteriorated, but they're actually holding pretty stable at the moment. Where we've seen the most significant change is around the sufficiency in our care home provision, which I will come on to talk about later, and that is purely driven around the impact of the Omicron variant, and the fact that because of the spread of that variant, we've got more homes closed than we would expect to see, so those beds aren't as available as we would want. We have got sufficiency in the market, but what we haven't got is the ability to access those while we've got COVID in them. We're going to give the update on the national picture. I think it's really important, and Councillor Wolf and Vivian really wanted us to hone in on that and to look at a survey result that was conducted during the Christmas and New Year period. And then we're going to review the actions that we'd put in the November report and tell you what was new and what difference some of those has made. And then, as Councillor Wolf's also said, at the end of this presentation, we'll be asking for the support and help of the committee and to come up with any ideas, really, because we're open to all of it. If we could move on, please. So during the Christmas period, so between the 24th of December and the 5th of January, ADAS, the Association for Directors of Adult Social Services, asked all local authorities across the country to complete a winter contingencies survey. The survey covered those areas that are bullet pointed there, all of which will be covered in today's report, and I hope you found all of those to be covered in this presentation. I hope you found them all to be covered in the report itself. The survey was completed by 94 local authorities, and of course in Dorset we completed that as well. The overriding conclusion is that this is an unprecedented time in adult social care, and it describes things as a national emergency. And also, when we've talked with our regional colleagues in the Southwest are particularly hard hit because of our rurality and because of, for some of us with an ageing population as well, that's having quite a significant impact on our ability to manage our sufficiency. We could move on. So just some of the really clear headlines that came out, and I've got a few slides on this to share with you, but this just does set the tone. So all 94 local authorities that answered this survey are implementing at least some contingency actions in the current circumstances. So Dorset is certainly not on its own. Everybody is having to take different action to try and manage. Directors are finding that the decisions that they're having to implement are unacceptable. It's not decisions that anybody would be wanting to make, and everybody is struggling with the same thing. We are all talking to each other and thinking about different mechanisms that we can put into place. The survey itself, where you've got that there, where it talks about different staff being redeployed into other areas. Certainly in the operational side of our business, Steve and his colleagues are redeploying staff into different teams, and also we've gone to our colleagues within the council to look at what staff can come over and help within adult social care. 49 councils are, for at least some of the time, taking at least one of the measures needing to prioritise care and assess risk that directors regard as least acceptable. And we're having to do that. And every day the operational and the commissioning teams are meeting to review everybody that we've got waiting for care. And we're having to reassess that every single morning. And we see the chat come up every morning with the colleagues are looking at what care's available and where we're going to position that. We are all asking carers to do more, unfortunately. And we are asking the voluntary and independent sector to come and step in with us. And over the Christmas to New Year period, we had the Fire and Rescue Service doing welfare checks for us, giving us mutual aid to support. And that's not unusual across the country. That's what everywhere is doing. So if we can move on, please. So further highlights then, 82% of councils are continuing to meet people's core assessed needs, but are asking people using services to accept that they need to be flexible. And in Dorset, we're doing that as well. So we're having to speak and say to families, ordinarily you would want care to be there at the time that's the best for the person. But at the moment, because of the way that the services are stretched and because of the workforce issues and lack of workforce available, we're having to adjust timings for when people are getting their visits, for example, when people need a home care service to come in. It doesn't mean they're not getting that service, but we're having to adjust those times to use the time flexibly. 43% of local authorities are reprioritising support to those most at need, most at risk and essential activities only. And we are one of those 43%. We are reprioritising all the time, particularly as we have a number of providers that are giving handbacks. And by that, what I mean is that they can't deliver and continue to deliver the care to that person that they're supporting at that moment in time. So we're constantly having to reprioritise. You can see that on that slide there, it goes down to 38% of local authorities are moving to welfare calls for some people. We've done that where we've assessed the risk and we've felt it's been acceptable to do that. It has been few and far between. And then you see that a further 13% and then going on still to a further 11% are reporting that they are facilitating social contact. And I've not highlighted those because we don't believe that we're there in that position. So if I can move on again. It's important to think about the workforce and to see what's happening nationally. You'll have seen it on the news. It's a constant topic of conversation, but 81% of councils are taking measures to improve workforce recruitment and retention with paying staff incentives. The government have put a significant amount of money in, which I'll come on to in a later slide, to try and help with recruitment and retention. And I'll explain later what we're doing as a local authority to pass that money forward to providers. Nationally, what's being reported is there's a 10% reduction in the number of professionals needed, and we've listed some of those there, but particularly therapists and the approved mental health practitioners there's a national shortage of, and we are feeling that as well in Dorset. Providers are reporting a higher level of vacancy rates than they've ever reported before, and they're not able to fill those vacancies. So everywhere across the country is putting in place short-term and long-term actions to try and improve the capacity. We're doing that as well. later on in the report, as you'll see in detail, what we've been doing in Dorset, and we are considering every opportunity. We're looking at the staff incentives, we're looking at whether it's appropriate to set up a bank and what would that offer. We are looking at, we've given car parking permits to carers to try and incentivise them to stay within the market. So like all local authorities, we are trying to think about every option that we can, and actually at the end of this presentation we would welcome your views to think about what other things we might have missed. If we can move on, please. So there's just a couple more slides, I think, in terms of that national message, but it is important to share these with you. So 88% of local authorities are needing to change their procedures and are going off contract to spot purchase home care. So in Dorset, we've got a good, in terms of our Dorset Care framework, and we're in the middle of changing that and refreshing it. But in terms of our existing framework, 85% of our home care providers are already on that and working with us. At the moment, what we've got is 72 to 74% of our activity is at the framework rate, but because of the number of hours that we've got outstanding that we can't source, we're going off framework as well, which is, it's just sensible to do that to try and get as many hours as you can. So we're in quite a good position in terms of that, but that doesn't mean that we're getting the hours that we need to support the people at home. 46% are going off contract to purchase home care from providers who are requiring improvement or with less than 1 year of experience following a due diligence assessment around risk. We are also in that position. We have put in place new providers into Dorset that have got less than 1 year's experience, but we have done that risk assessment first before taking those on board. We've got 3 providers in home care providers in Dorset that are CQC registered as CQC rated as requiring improvement, and we are risk assessing before we go and use those providers. The quality and improvement team within the council goes out and meets with those providers routinely, and we're working with CQC to see improvements that are being made, and then we're making a decision, a risk-based decision as to whether we will use those hours. We're having to use all the hours that we can find in the system. And then you can see the last one just there on the bottom, which I don't need to go into any further. If we can move on to the next slide. This now we're talking 81% of local authorities are co-commissioning, so jointly with the CCG or with the acute hospitals, more rehab places in care homes or at home and doing step down beds. We have also done that co-commissioning. That would have been part of the Home First report, where we've bought additional care home beds with the view that we can put wraparound services in there with therapists coming in. But as I said earlier, we've got a shortage of therapists, but the agencies are pooling together to see what they can do. And we have been looking at our rehab services and our short-term services to see how we can bolster those. We have indeed, as you'll have seen in that Home First report, for people coming out being discharged from hospital, we have put some additional capacity in. There hasn't been new capacity since the last report, but additional capacity was put in. What we also need to be mindful of is those people that are in their own homes, because what we want to do is continue to do that admission avoidance to keep people well and safe at home. So we are making sure that we're doing that dual focus, doing the admission avoidance and doing helping people out of discharge with that. 52% of local authorities are commissioning new accommodation like care hotels, and you'll see in the report that jointly with the CCG and with BCP Council, we've also got a care hotel that's come online. It says in the report it's 16 beds, and I think it was that at the point of writing, it's actually 18 beds now that have been taken, and that's for people that are discharged from hospital that need some time for a maximum of up to 2 weeks before we can source the care to help them to get home. And 33% of local authorities are having to ask carers to provide more support, and indeed we are in that position. We're having to speak to all family members and carers when those assessments are completed to see what can they do to offer. And that in itself can sometimes prove difficult, doesn't it? And we are certainly mindful of any breakdown. We don't want to put too much pressure on carers because that's not helpful either. And the social work staff are working with the families to make sure that that's in place and the support's there. If we could move on. So the current situation in Dorset. So I've talked a little bit throughout each of those previous slides. I've given some examples about what's going on, what we're doing in Dorset. But just to be really clear, we are prioritising those for those people most in need, as you'd expect. We are, if you look at the far hand right hand side words, we are taking mitigating action to safeguard those people daily, and that does take the form of the staff members reviewing everybody on a daily basis, as I referenced earlier. We do have people waiting for home care, and we do have people waiting for care home placements. We have had additional staff in to help the brokerage teams, and in fact there's been an additional commission put in place that was referenced in the Home First report to try and get some extra resource in to try and make those moves more quickly. But the brokerage teams themselves and the CAT team, that's the team that support people out of hospital, with the limited supply, it makes it difficult to do that sourcing. But where we can, the council have certainly stepped in, as have other agencies. Actually, the Acute Trust had helped give some of their staff, their bank staff, to help bolster that brokerage team to help try and move people through. You'll see across the bottom there that we have seen, and this was reported in the previous report, but I think it's really important that we remember this, that we've seen an increase in the average number of home care hours that are needed. So people's needs are getting more complex. So what we were seeing pre-COVID was that on average people needed 13.6 hours of home care per week. But since and during COVID, that's gone up to over 20 hours a week. So you can see that we've got a problem with the workforce, because the workforce are also not wanting either to work in the sector or at points are poorly. And at the same time, we've got people coming through our system that need more care than they would have done previously because of the change in the need. There has been a significant change in need. And that has also been reported across our South West colleagues, as we were on a call last Wednesday when other local authorities cited the same thing. So that's not unique to Dorset, that is happening across the South West as well. We are asking other organisations to step in. I mentioned the Fire and Rescue Service, and actually the Volunteer Centre as well has now put in place an out of hours service, so and a weekend cover service. So our out of hours statutory service is delivering as you'd expect, but the Volunteer Centre are helping go in and do that additional. We make referrals through to them. That's working really well, but that's helping people to stay in their own home and preventing them from having to go into hospital. And I referenced earlier on that we had a number of handbacks, and you'll see that in the report. There's a chart in the report, I think it's 3.1.2, that particularly looks at handbacks, and you can see how those have increased latterly. So if we can move on. So in terms of this is snapshot information from the 14th of January, and this figure changes daily, as you can imagine. But on that particular day, we had 340 people that were waiting for care to be sourced. Now, please don't think that that means they didn't have care in place. It means that their assessed needs wasn't being met as we would want them to be met, but things were in place. We are seeing on average a deficit in care hours. This is home care hours of 15% lower than what we need for social care, and we're struggling to find those hours. And there's similarly a deficit in home care hours that health are needing to provide. For adults with a learning disability or in need of mental health support, we're seeing an improved position on that, which is good to be reporting, where the number of unsourced hours has been reduced quite significantly. However, that needs to be balanced against the fact that we are seeing a 43% increase in demand for mental health support. And indeed, not only are we seeing that need for mental health support within our community and for the people that we are needing to support, but also the providers are talking about the impact this is having on their own staff's mental health. And so that was one of the things that providers were talking quite significantly about at 2 of the forums I had last week. If we move over. In terms of care home provision, we've had no new care home closures since we last presented to you in November. One provider has changed its registration. They were dual registered before, which meant that they could deliver residential and then residential with nursing. They're now no longer delivering the nursing element because they can't find the staff. Omicron has made a significant impact on our sufficiency. Excuse me. On the 29th of December, out of our 118 care homes, 30 of them had got outbreaks or incidents of COVID in them. Then on the 4th of January, that had gone up to 63. That's a 6-day period. It had doubled. And I was hoping in time for this meeting, I was hoping that we'd have seen a reduction in that as the variant figures are coming down. However, it's still at 63. I checked that out with my colleagues in the Quality and Improvement team last week. And that's because whilst some people are obviously getting better and the isolation periods have stopped, we're finding more people in the homes are getting that, and then the home still has to remain on caution or closed to new admissions. We're hoping, though, that that figure should start to come down soon, and I'm hoping by the time we next come to see you, that will be significantly improved. I started the presentation by saying it's complex, really, in terms of the beds that we've got, because currently we're having to report we don't have sufficiency, but that's because of the number of beds that we can't access. We've got 3,724 beds across Dorset, and generally we report we're generally reporting that we've got between 13 and 15% of those beds available. And on the 25th of January, what the capacity tracker was reporting was 16% of beds available. Now that is actually accurate. Those beds don't have a person using them as their home. However, when you overlay that with the fact that you've got 63 care homes that have got COVID, those beds aren't actually available for use without a very thorough risk assessment, which we do jointly with the CCG, the council and the public health team. But what it did mean, for example, on the 31st of December, is that we only had actually 54 residential beds and 24 residential with nursing beds that weren't closed to Omicron. And you can see that that's a really small percentage of our actual overall beds that we've got in the system. If you could move us on. So I know this is busy in the very small words, so I apologise for that. But this slide here sets out the actions that we're taking across Dorset. They're the short term and the medium term and the longer term actions, and they're all listed in your report. I've tried to capture them in this way for ease. I won't go through each of these boxes because it's either written in the report or I've said some of it already. But I will just pick on a few if that's okay. So we have gone, as I've said, to the voluntary and community sector to ask for help. And they've really pulled all the stops out, I have to say, and they continue to deliver that for us, and that's brilliant. We had a Better Life stakeholder forum the other week, and the providers were just explaining, the voluntary were explaining to everybody there the different things that are on offer. And I think that's testament actually to how the community is stepping up and what is taking place. Dorset Council, we've taken reports to the local authority, to the SLT, to the leadership team, and put out a call to arms to ask other departments and other directorates if they can find and source some help. And we've had a good response to that, and we are looking through that now. Steve, with his operational colleagues, are looking at where they can redeploy staff. So they're already putting staff into the hospital to try and help, and changing some of the way that some of the staff work to try and just keep reprioritising and focus where the best efforts can be made. We have made a decision to appoint a workforce lead, and they're going to be working across with the integrated care system partners to look at best use, and that workforce lead will be focused on thinking about our own internal workforce, but they will be primarily thinking about the external workforce and what we can do with the CCG and with our other stakeholders, and the universities particularly, to think about those career pathways and what needs to be done in the long term to try and generate and help improve our position in terms of greater recruitment and keeping people retained. That group itself will be also looking at the options around, well, that lead, if they're in time, will also be looking around the options on the bank, and whether that makes good sense for us to do that. We have been working closely with our provider of last resort, and they've been flexing their support, particularly around those handback packages that we've got when we can't get a home care provider in, which has been incredibly helpful. And we have been looking at what we can do with the CCG. At the moment, all the funding that we've got coming through is short term for recruitment and retention, and what we're doing is a number of actions now to think about what's going to happen in the long term and how can we stabilise the market. We've been doing some work with housing colleagues who are working as well and thinking about supported living, and you'll remember at the last report we talked about we've got new entrants into our market, which is great, but housing colleagues are also working fiercely with housing providers to see what else can be offered, and there's an emerging housing strategy that I'm sure will come to the committee at some point. I'm just trying to look at some of the others I could pick out. There's a slide later on in the pack around the grants and the money that's coming through, so I won't labour that right now because I'll repeat it. But we are also, I think the final thing I would say is that we are working with unpaid carers and offering direct payments to those family members where they can do more, which we may not have been doing as frequently as we are doing now, but certainly the government have been promoting that as something to be doing. Okay, so if we could move to the next slide. So I talked about, so these three things here, the Workforce Capacity Fund, the Recruitment and Retention Fund and the Adult Social Care Omicron Fund, that's the money that's come into the sector that's all got to be spent by the 31st of March. That's a significant amount of money. Now in December, what we did was we passported a winter retention bonus to care home and home care staff that are included on our capacity tracker. That we had some positive comments and feedback on doing that. We've also, thinking about the rest of that money though, now that we need to spend, I've had 2 provider forums last week with my colleagues to see if there is anything particular that they want us to do with that, what's the best use of it. And you'll be familiar with the fact that some providers are already going abroad to see if they can increase and recruit from abroad. We're looking at what is the cost of that, and is that possible for us to help with that. We're looking at continuing with the winter retention bonuses through February and March to help people in the sector, and we're looking at what is it that we can do with the to improve the voluntary and community centre offer to help with that admission avoidance piece. So we are doing a lot of talking to the sector. Some providers have come back and said that they would really appreciate some funding to have a golden handshake. Other providers are less keen on that because they think it makes people move from one organisation to another. Some providers have said, could we have a fund so that they could pay for overtime? So we're looking at all options actually. The short-term nature of the funding though does hinder our long-term strategic planning. But we are working with colleagues in the CCG to look at what is that long-term offer that we're going to make in order to stabilise the market. And once we've completed our cost of care exercises, that will be something we will be talking to the council colleagues about and the CCG about, because once that cost of care exercise is undertaken, it will tell us what the true cost of that care is. But it is important for us to note that the national advice at the moment is that there is likely to be a requirement for a 6.6 increase in the fee rates. So if I can just move us on. So we're coming to the end, and I apologise for talking for so long. The next steps, I'm not going to read through those because those are exactly pulled from the report, but this is what we're planning to do. I'll just touch for a moment on the Market Sustainability and Fair Cost of Care Fund. The government on the 16th of December announced the Market Sustainability and the Fair Cost of Care Fund. What they are requiring now is that we've got 4 actions that we need to undertake during this next year. One of those is a cost of care exercise and the requirement to publish that. We were already halfway through our cost of care exercises before this actually came into being. So we're doing well with regard to that, and we're using 2 providers, one called ARC and one called Valuing Care, and they're undertaking that work for us. We would like to come back to the committee and give you the outcome of that later on when that's been completed. But what that will do is help show an independent view, as I said, on what the fee rate should be. We can't predict what they are going to be other than to say what I said on the previous slide, to take account of what's being said nationally. The second thing that Market Sustainability and Fair Cost of Care Fund require of us is to get much more information about self-funders, and in Dorset we have a high percentage of self-funders using our services, so it is important that we get more information on that because that will affect the way that we commission our services. And what we're also required to do is produce a market sustainability plan. I think that's by September. Because of the work that we've been doing with yourselves and because of the work that we've been doing locally, we're going to be in a reasonable place to present that and be ready to present that. But it does mean that there is going to be much more focus nationally as well on everybody having those plans in place. So if we move on to the next slide. So the recommendations from the report are set out at the beginning, and I'm sure Councillor Taylor will be going through those at the end of this. But they're what we're asking of this committee. And then on my final slide, if I can just move on to Councillor Wharf.
Thank you, Leslie. I've got a bit of, don't know why I've got a bit of a feedback. Oh dear, I'm sorry about that. Can I just, 2 or 3 things. One is, it's a very content-rich presentation, and as I've seen it develop over the last few days, it sometimes leads you to think about things and ask questions sometime after you've seen the presentation. So I entirely understand if members, when they review the presentation that we'll send to them later, if they have further questions that they don't think of at the time. So please feel free to contact either myself or Leslie with any further questions you've got. Can I again thank the staff, because they have been working ridiculously long hours in order to meet the requirements and in order to provide you with this information. And the voluntary sector, I thank them as well, because they've been incredibly helpful. I know that you members will want to ask questions of what we're doing and want to make suggestions, but if I can just turn it round for a minute and talk about what you can do for us. And we've made a call to arms to the staff throughout Dorset Council. And if you remember, at the beginning of the pandemic, we had what we called a dating agency, where we tried to identify those people who might have skills to be used in areas other than their normal areas of working. We've done that again in order to try and get staff generally to do voluntary assistance. But what you can do, members, and if I start off with what we can't do, we can't let you know about hospital discharge or hospital entry. So in terms of your surgeries and in terms of your interaction with your community and your community groups, what I'm asking and really begging for you to do is to work hard with your communities, and I know you are, in order to get them to tell you when there is somebody who is either about to go into hospital or about to come out of hospital, or who's got some care needs that can be met by local residents. And if you can help in that process, you would be absolutely amazed at the major difference that could make. I'd ask that you go and talk to your local town and parish councils of the situation to make it public. And basically Spencer and I are absolutely monthly now talking to our MPs about the issues that they need to support us on, and we are lobbying them in terms of adult social care and in terms of the government support. And if you can do the same, please. I mean, I think it's one of these things where this is completely non-political. We all need to work together, and we need to get through that. We are affected because of our rurality, because of a number of other situations, and we need help, and we're doing a brilliant job, but actually it is unbelievably difficult, and we need support from our MPs in order to change the national picture, but from our local residents in order to help us in a local situation. Councillor Taylor, thank you very much for allowing Leslie to do that presentation, and again I thank Leslie because that was an incredibly detailed presentation, and I look forward to your questions. Thank you very much, Chair.
Okay, well, I'd like to second Councillor Wolf's comments. I thought it was an extremely good presentation. What I'd like to do for the debate on this, if I can go first to non-committee members, because I think we've got quite a few of them on the call today, and then I'll go to committee members, and then I would like to focus on the last slide on that slide deck, which was from Councillor Wolf as to what we can do. So if I can go to the non-committee members first, and I think I've got Councillor Taylor with an RTS. That's David Taylor.
Thank you, Chair. Good morning. Good morning, team. Yeah, the presentation was quite in depth and amazing, really. I've got several questions. Thanks to Councillor Molly Rennie saying write them down before I speak. So I have done. You mentioned you've got a hotel for care for patients after hospital, 16 beds, I think I heard. Is there more scope out there to get further hotels to actually help us with our situation? Second question is asking councillors to assist with recruitment. I don't hear anything about us actually being involved with the recruitment of helping the community apart from conversations online. Unemployed people, are we not talking about the job centres and the government figures to say these people that are working or sent at home with benefits, why are we not asking them to actually step up and actually work with our communities? Neighbourhood contact teams, have we contacted them to see what's going on? And also, are you looking at the fact of the problem just in case of DBS checks? Because there are strange people out there.
Would somebody like to pick up on those questions, please?
Sorry,
Leslie. Leslie, you're on mute.
Sorry, apologies. I'll do my best to answer all of them. I might need to come back to you on the second question if that's okay.
Thank you.
So I had written in the report that it was 16 beds for the care hotel. It's actually 18 beds.
Right.
I'm just looking to my colleague Steve to nod. Thank you very much. Didn't want to have that misinformation in there. Your question was around, is there scope for more beds like that? There is absolutely scope for more beds. However, what there isn't is the care market, the workforce in order to facilitate those. So we've brought in a new provider to deliver that care in that care hotel. But there isn't more staff. We would have possibly done more, but there isn't more staff that they can offer in order to deliver that. However, as Mr. Steve Vivers would be saying to you, actually the problem comes with that care hotel in that when we move into our holiday period, that hotel is not then the best use that the care hotelier would want to make of it. So Steve, do you want to come in and respond to that latter bit?
Thank you, Leslie. And just to introduce myself, which I forgot to do at the very start of the meeting, I'm Steve Hughes. I'm the Corporate Director for Operations for Adult Social Care. So thank you, councillors, and thank you all. So Leslie is absolutely right. The staffing situation to be able to stand up any additional care hotel beds would be one element. The second element that we would also advocate is about the best use of any additional staffing capacity that we do have. We are always of the view that home is the best place for people to recuperate and recover. Therefore, when we have these conversations about a block of staffing that does become available to stand up maybe another 2 or 5 or 10 beds, we have to weigh that up against the ability to deploy those members of staff against supporting people to come out of hospital and go straight home again, which is always our first preference. So again, as Leslie's indicated, on a daily, weekly, monthly basis, the system, ourselves, the CCG, the Acute Hospital Trust and our community health partners have those absolute conversations about where we want to make the best impact to be able to support people in the best possible way. And that is exactly the conversations we do have.
Thank you.
So you're sorry, Jim.
No, I was just sorry. Going back to you, Leslie, please.
Your second question, I didn't write it all down. Would you be able to repeat that for us, please?
Yeah, the second question was asking councillors to assist with recruitment, and also the fact of looking at the fact we've got unemployed people within the county getting benefits. Can we not look at those people to see what skills they've got to actually assist us?
I think that's something that we need to do more of with the job centre, actually. I mean, the care providers themselves, I suppose the care providers themselves are constantly doing recruitment campaigns. There's a national campaign that the government relaunched in November, and it's running back again through January and February. And everybody is doing absolutely everything to try and promote the workforce, to try and promote those vacancies, so something isn't that if there is that significant gap with the number of people that are unemployed and then the gap in the vacancies, we do need to look at doing some more of that matching, I think, and working with the job centres around that.
Can I come back into that? Because the fact that the communications team, we have communications, as you know, every day, updating what's going on over the weekend and in the week. I think it might be worthwhile looking at the communications comms messages to see how it can be actually advantageous to us to work out how we can help with actually recruiting as well, because that could be quite a interesting market to actually go in there to make sure we know what's going on.
Thank you for that. It's helpful. We'll come back to you on that for some more ideas around that, if that's okay.
Okay. Thank you very much. Have you finished your questions?
No. A third question was the fact of the neighbourhood contact teams. We're looking at the, well, I for example look after a couple of people next door. They're aged and not in good health, and we've been doing weekly visits, daily visits actually, and weekly visits to making sure they get everything they need. Is there a possibility of looking at engaging the neighbourhood team contact again? Because when we had it in the early, I think it was 2000s and 90s, it was very effective, especially with crime prevention. That was a big thing in Dorset. We knocked on the head about the crime problems in Dorset. We've got the neighbourhood teams to actually look out and stop it.
So shall I come in on that one as well?
Yeah.
I think that's something else we would need to explore with you as well, if that's all right. Can we have a separate meeting outside of here so we can discuss all of that?
That'd be fantastic. Thank you.
Then we can work together to do it. What we did do just last Thursday evening, actually, we was invited to the Councillor Wolf and I were invited to the Blandford Patient Participation Group, which was a really interesting meeting and an interesting group. And at that meeting, we were talking about what are the community groups and structures that you've got in place. And actually, Help and Kindness, one of our local volunteer centres, I'd got them in advance to do me a list of all of the different community groups that are there to support Blandford. And the list was incredible, actually. Yeah. So that sparked in my mind that we need to actually do something more about just sharing out with towns and parishes or however we can, just a gentle reminder, these are actually here in your community. So I was going to get on with Help and Kindness and then make sure we can get that out. But that's slightly different to your neighbourhood contact teams. I appreciate that. And I think that is something else that we can look at.
You can definitely look at it, especially with Les. I know Les Fry's online and he'll probably come in with the question as well. It's just interesting to know that we're joining up. As I've said time and time again, communication, let's talk with each other, let's understand what's going on. And this is a very interesting meeting. Thank you very much.
Okay, thank you very much, Councillor Taylor. Can I go on to Councillor Kimber now, please?
Yeah, thank you, Chair. Can you see here? All right. Thank you. 2 points. The first point is in our Portland community, as you know, the MIU at the moment is closed down, but we do have empty wards. I believe 2 empty wards in there. Is there any thought that that could be used? I know it's a bit of it's a great deal of concern about in my community about if you like, doing something practical with the hospital. And the other point is you've asked for volunteers. If it could be circulated who and where to volunteer to, so we can pass it through to the community. I apologise that I joined you late. That was because I'm under a strict medical regime as well. Thank you.
Okay. Does that need a response? I think Steve's coming in. Okay.
Thank you, Councillor Taylor. I can give assurances that every available option is being considered, including community hospitals, for additional capacity to help support the rate of discharge and people being helped to discharge out of acute really intensely. So, for example, one of the conversations we have had within the last month is around for the preparation around the Clare Hotel was around where could that best be served. And as Leslie has said, some of the difficulty is not necessarily the accommodation per se, but the staffing to support it. And particularly in community hospitals, our health colleagues, particularly acute and community health colleagues, are having to draw as much deficit in staffing, the lack of staffing, just as much as our care providers are. So people like nurses, matrons, consultants and GPs to be able to help support those community hospitals are just as hard fought to try and get. So that would have been some of the decision making that we would have came into with looking at as additional capacity in those community hospitals, but it was definitely looked at.
Okay, thank you.
Okay. Vivian?
Apologies, Chair, because I've seemed to have lost my hand, so thank you for letting me come in on that. Just to echo what Steve said, I think it's really important that this is a very dynamic situation. So all of the time, all of the resources across health and care are being looked at across the system. So the care hotel will be reviewed on a constant basis, how it's working, and that it is meeting the needs of people that it was set up to do. And likewise, any facility that is available in the community settings are being looked at. So it's not this is what we've got and this is all that we're going to have. We are constantly looking at it across the system, across health and care with the acutes and our ICS colleagues. So really important that if it's helpful to understand that as one element works or there is a change in flow for people coming in or needing to get out of hospital, we are dynamically looking at what else is on offer and what actually works. And it's not just in Dorset that we're looking at that. We are taking good practice from elsewhere and trying to look at that in the Dorset environment. So we're bringing that in for across the system and having those conversations. So I just wanted to assure the committee that it is a dynamic process, that we are taking the best in the country and re-looking at it and what could work for Dorset as well. Thank you.
Okay, thank you very much. Can I now go on to Councillor Ezard, please, and then we'll go on to committee questions.
Thank you, Chairman. Good morning. Yes, I worked at as the Governor representative for Dorset on the UHD United Hospital Dorset last week, when it was mentioned by the Chief Executive Debbie Fleming that a care hotel facility was opened last week. That was, I think, reported in the Dorset Echo, and I wondered whether that, for clarity, whether that's the same one that you're talking about or whether it was a separate one. Could you clarify that for me, please?
So we can confirm that is the same care hotel that we are discussing.
Okay, thank you very much. Right, can we go on to committee questions now? And the order I've got at the moment is Councillors O'Leary, Gorringe, Pipe, Legg, and I think I've got Reddy has just come in as well. So if I could go over to Councillor O'Leary, please.
Yeah, thank you very much. The average cost of bed is really high. Can we do anything about the price to help get that lowered?
Would you mind if I answered that one?
Yes, please do, Leslie.
So thank you for the question. So what we're doing at the moment is looking. Oh, have I crashed?
No, you're okay at the moment.
So we're undertaking two cost of care exercises, one for care homes with an organisation for core value and care, and one for home care and supported living with an organisation called ARC. The point of those cost of care exercises is that they will give us an open and transparent account of what those costs actually are to that provider and what is fair and reasonable for us to pay. So I'm not sure that it will be around bringing the pricing down, but whatever will come out will tell us whether what we are paying is right. Now, the government are requiring us now to publish. It's fortunate, as I said earlier, that we're actually doing ours and we're already halfway through. The government are going to ask us to publish those rates, which I'd like to share with you as well before we get into that when it's concluded. But it's difficult to say at this moment, are they exactly high, because until we've done that work, we're not able to say that.
Okay. Sorry, could I just ask Leslie, we've got these coming. Did I have a conversation somewhere about this coming to the March agenda so we can look at the scope of the cost of care exercise?
Yes, so when we say that's correct. That if the committee are wanting to, we can bring the cost of care models so that you can and have a discussion about those, so the committee can understand the what it means to have a cost of care exercise and what's involved in it. And then what we will do later on, when we've done our analysis of our actual feedback into Dorset, is we'll also bring that back at a later date as well.
Okay, I think that would be very useful if you could do that, please.
Yes, do that in March.
Okay, the
Vivian,
next...
I think, wanted to...
Sorry, Vivian.
No, absolutely fine. And I was just going to pick up that point that we were going to suggest that we would bring the template that's going to be used nationally, so everybody could be aware of it, and then the analysis sort of later once that work has been completed. The reason why that it's a national ask of everybody is that everybody across the country has seen the cost of care rise hugely during the pandemic, and the cost of care homes pricing has also risen. So this is a very timely and a right exercise, and a very useful exercise for Scrutiny then to look at once we've got the analysis in place, sort of late April, May time. So thank you for that, Jill, for allowing us to put that back on the agenda. But it's not just a Dorset issue, it's absolutely a national issue.
Thank you very much. I think the thing that I'm very heartened with that is the fact that although it's a government initiative now, we're actually ahead of the curve and have already started it in Dorset. Could I go on to Councillor Gorringe, please? For your question? Here we go.
He's there.
Thank you, Chair.
Thank you very much.
Thank you, Leslie, for the presentation. Obviously, a lot of information there actually to absorb. You did mention about, or I'm going to mention about care home closures, but you did say that there hadn't been any additional ones since the last presentation back in November, which is probably good news. But how many? Could you just refresh my memory as to how many have closed?
Since the beginning of the COVID period, I think there's been 4, but I do want to check that before I say that confirmed. So I will definitely find the exact answer for you, but I think it's certainly been 4.
Okay. What about other contracts as well for care? Is there any other contracts that would have been sent back to the council that, like in BCP, I hear recently that there's been 76 contracts that have been returned to the council. We had anything like that?
So there's different types of contracting arrangements, aren't there? There's ones where you have a large contract with a provider, and then there's an arrangement where you have a spot contract. So on those large contracts, I'm not aware of any that have been returned to the council for a provider wholesale. But what we have had, as I explained, is a number of handbacks of services where the provider is not able to fulfil that arrangement. So we do see that on a weekly basis. We're seeing that it's under 3.1.2 in the report. So that is happening, and I imagine that will continue to happen for the foreseeable future because you can see that there's an increase, but we haven't, in terms of a large provider, given the contract back to us, or in terms of a provider giving the contract back to us.
Thank you. You said earlier on about 340 care home on the places on the 14th of January. Could you just explain that a little bit more?
On the slide,
are they people that are actually looking for care in their home, or are they looking for care in a care home?
do you want to come in, Steve? I can see. Are you happy for me to go? Yeah, so sorry. So that was a snapshot in time. That was 340 people on that day that were waiting for additional hours of care. Now, that didn't mean they were on a list, the list for us that we were aware of. We'd assessed their needs and they needed some additional support to go in. That doesn't mean that those people didn't have care being provided already. And it didn't mean, and that could have been provided in a variety of ways. It could have been with a provider going in to their home, but they've already been assessed as needing some additional hours of support. You'll remember the slide that I said the average increase in the number of hours that people have needed has gone up significantly since COVID came in. Also, it might be that they've got the family members providing some support. So, but what it means is that they've been assessed as needing a particular level. They're eligible for that level, but we can't necessarily deliver to meet that quota. I think that's the explanation, and it is in people's homes. Steve, you're nodding, aren't you? I had always looked to Steve to just do a belt and braces on stuff like this with me.
Is that okay, Councillor Gorringe?
Well, just one other quick question. That we got we had a very good community hospital down in St Leonard's, which it was closed 18 months ago, and it would have been nice if we could re-erect that and get it up and running to take some of these people out of hospital that are holding up the list. Anyway, thank you for that.
Okay, thank you very much. Could I come on to Councillor Pipe now, please?
Thank you, Chairman. I see we have 3,724 care home beds available, many of which, of course, are unavailable through Omicron COVID. What will actually happen when we run out of beds? I hear what Councillor Ezard says about there being a care hotel. Whether that's actually online or not, I'm not sure. But what arrangements are in place to make provision for more care home beds?
I'll come in on that first of all, and if you want to step in. So that provision, if all of those were open to us, that is enough provision for our area currently. We're doing a care home strategy review at the moment, and that will articulate what our forecast provision needs to look like. But currently, that's what we have, and we could manage if all of that was open. Now it's a changing, as Vivian said earlier on, this changes day in, day out in terms of what's available to be used. And at the moment, we are seeing that we haven't got sufficiency to be able to access the number of beds that we need. However, and this, we're following national guidance here. National guidance says that if you do a thorough risk assessment, you can still place within those care homes, even though there might be Omicron variant there, but you have to make sure you've satisfied certain conditions. And we have a risk assessment process that is multi-agency, so it's the assessment is done by the CCG, the council's team, and by public health colleagues, and they make that decision around risk about whether it's safe to agree to a placement taking place within a home that might have Omicron. So that's how we're getting, well, that's how we're using that, because it's one of the tools that we've got to employ because of the lack of beds that haven't got Omicron in it.
Okay, would the client, let's say, who may enter an Omicron infected home, these would be individual rooms, I assume, rather than like a ward setting?
Yeah, no. So there's really, ever since the beginning of the pandemic, whether it was the first variant or the variant we're in now, there are really clear conditions around people and in terms of the isolation and in terms of the use of personal and protective equipment. So that person should not come into contact at all with anybody else, and they'll have ensuite facilities as well, which should prevent that. So it'll only be the staffing. I don't know if you'll recall, Councillor Piper, but earlier on there was all concerns about people not being able to see other residents for a 14-day period. Now the guidance and the rules have changed over the time, and that's certainly reduced now, but there are really strict infection prevention and control measures in place that all of the care homes and all of the staff entering those homes have to comply with. And we've been keeping on top of the guidance. You'll see in the beginning of the report, early on in the report, I listed the number of changes that had taken place just in December. And literally every time something comes in, we take account of that and adjust our procedures to make sure that we comply. So that infection prevention and control is key. I mean, it was key even before Omicron because of other different things that were affecting in care homes, different types of things that were there, but that it is complied with all the time.
Okay, thank you very much. Thank you, Chairman.
Can I just ask a question allied to that? That's one of the ones on my list. When you went through, you were talking about doing the risk assessment for somebody who has to go in or is potentially going into a home where there's already coronavirus. What sort of weight is put on the patients and the patient's relatives' opinions on that? And I'm looking at that both ways because some people may not want to go into a home like that, or some people may say, you know, I don't care, I'm quite happy. And I just wondered on the weight that is put on their opinions.
So that, oh, you come in, Steve, go on.
I was going to say, I don't mind taking this one, Leslie. So, Councillor Taylor, that's a really good question. And irrespective of outbreak of COVID or otherwise, that is absolutely a conversation that goes on between social work staff, the individuals we are in discussion about, and their family members. So for each and every person who is discharged from hospital or who are living in the community and talking about entering residential nursing care, that is always a conversation that is discussed even before a decision is made about which home to go to. So that conversation, that is a very strong point of the practice that social workers do with supporting people about talking about their next steps within their care journey, particularly around entering a care setting like that.
Okay, so it's the social worker who's representing the family and the patient. Sorry, would you like to come in, Vivian?
Yeah, thank you. And I think it's really it's a really good point to raise, Jill, and thank you for raising it, because it absolutely has to be with the family and with the individual. It's always the premise, and that's why Steve's teams are absolutely essential in this process, that no decisions are made without people and their consent and their families. And you know, you're having, you know, moving into a care home is a very big decision for people, even temporarily. It's a difficult decision. So that is also weighed up with the amount of care that somebody will need, and what assistive technology that we can put in place to support the family, and all of those balances are undertaken with the family and the individual. And the first point of call will always be to get that person home. Yeah, and that's why you know, this not having substantial care at our availability is a real tension for families and for the workforce at the moment, because our focus is absolutely keeping people safe at home and building on their independence. So that will always be our first port of call, even in these dire circumstances.
Okay, thank you very much. If I can go on to Councillor Legg now, please.
Yes, thanks, Jill. My question's really financial, based on Leslie's presentation, but bearing in mind the discussion you've just had, which started with Bill Pipe. If you were listening to Radio 4 this morning, there was a discussion from a family member whose elderly mother is in a care home, and they were talking about Omicron and the way in which lockdowns in the care home affect their ability to go and visit and have a normal relationship with their mother. And in particular, the point was made that even if a member of staff is the person who's infected with Omicron, they can be at home, there can be no Omicron present in the care home, and yet the family are effectively locked out, or the care home is locked down. And bearing in mind what Peter said earlier about us acting as a kind of conduit to local members of parliament, trying to influence them. Is it a good plan on our part to actually start bending their ear and saying, well, if there isn't Omicron present in the home, the care home, then should there be a different standard of care exercised in reaching a judgment about whether it's safe to discharge people into a care home if there isn't actually Omicron present in the home at the time? I'll come on to the financial questions next, if I may.
Okay, Steve.
Thank you, Councillor Tyler. Thank you, Councillor Legg. That's a really good question, and it's one of those eternal balances between risk and rewards. So I'd always advocate on being prudent with particularly the care that is being delivered to some of our most vulnerable individuals in Dorset. So we are talking about people who enter care generally being well at some point and having a number of vulnerabilities. So that balance, and I don't know if Sam Crowe is on the call, but I'm sure as our public health colleagues, they would have a really strong view around that level of balance between risk and supporting the maintenance of infection control in care homes for those vulnerable adults, and the rights and rewards of being able to do those visits and ability of family members to be able to come in. What I can say is I'm aware in Dorset, as well as many other areas, that care homes and the care home staff have really been going above and beyond in facilitating visits for individuals in individual circumstances to make sure that people are kept in touch. So things like, for example, Amazon devices, to be able to people to do electronic conversations with family members who are both local and far away. Having isolation pods set up within care home grounds or in rooms for families to be able to safely visit family members on those bases. So although it's a difficult and absolutely rightly a Department of Health and Social Care policy decision around that level of visitation rights to going into care homes, I would also always be saying around the support and protection of those individuals that are in those care settings probably being the most paramount that we do have to support.
Okay, shall I go on to the financial questions next?
Yeah,
Jill?
sorry, I was just making a few notes and thinking myself.
Right. Starting at the end of your presentation, Leslie, you talked about three types of fund which are available from the government, which by a quick back of the envelope calculation is about £3.7 million for Dorset. Do we actually have to spend that money or simply commit it by the end of the financial year? And if, well, whatever you're going to tell me, how much of that have we already spent or committed? I'm just thinking in particular, for example, you said earlier that 15% of there's a 15% deficit in home care hours. Could we use some of that money to spend on that deficit? And if so, how would we carry that forward when the money runs out? You talked about car parking permits for carers, which I was unaware of, which it seems to me to be a very rational thing to do. Could that be extended to staff who are employed by the health authority, for example? Because I dare say they would probably benefit from free car parking in situations where they're visiting people at home. And finally, you right at the beginning, you talked about the let me get it right, the Association of Directors of Social Services and their survey, and you were showing areas in bold where statements were made because we were in the same category of a group of other local authorities, and the figures that stuck in my mind were 43%, 42% and 38%, where you said we're in that group. Do you know anything about the group we're in? Is there some characteristic about the group we're in which we could identify and say, well, we're all local authorities of similar characteristics? Is that something where we should be lobbying to say to members of parliament, why are we in this group? Why is this group being disadvantaged?
I'll try and come in. I don't know if I'm going to answer all of these because there's a lot. So I need to come back to you, Councillor Legg. You've raised some interesting points. The bit around the workforce fund. So you're absolutely correct in the value that you've said, and it's published nationally. The grant allocation that we're given. My understanding is that it has to be passported through and out of our accounts by the 31st of March. That's my understanding. If it isn't out of our accounts by then the government will be calling that back. You asked about how much we'd committed, and so far in December what we did was we passported directly to staff via their employer, of course. We passported round one, tranche one of that money. Now that was about 790,000, and then what we did was we bolstered that with money from the Community Outbreak Management Fund, which took us to just over £1 million worth of spend that we did, and we sent out just before Christmas. So that part of the fund has already gone and it's been allocated, and what we've been doing now is working through a set of proposals for the rest of the use of that money, and we've got a number of different things that we are testing out now, which is what I wanted to do, what myself and my commissioning colleagues wanted to do with the providers themselves, which was why we held 2 sessions last week with the providers to say, look, we've got this tranche of money. In your view, what is the best way that we can spend it to help you? So by the end of, I think it'll be by the end of this week, or certainly the beginning of next week, then I'll have some firmed up plans to share with colleagues in the local authority and with Councillor Wharf before we make the final decision on that. But we wanted to really take providers' views into account because they're the ones that we need to make sure we have most effect. And the government are really quite clear that this money really needs to be passported straight onto the staff. It's about keeping those staff within social care. It's slightly different to your point is slightly different on the 15% of hours. So you made a point about, there was a slide that we showed that said there was a deficit of 15% of social care hours needed. Honestly, the conversations we have all the time with providers is how many more staff can you get in so that we can guarantee you the hours. And so that workforce retention and recruitment fund is there to try and encourage them to get additional staff in so that we can close that gap on that 15% reduction in hours. And we are having conversations with providers all the time where they're saying, oh yes, we think we've got another 2 members of staff joining our agency, but we need to close the vacancy gap before we put in support for new people. So it is a very challenging position to be in. Your bit around car parking permits to health colleagues, I don't have an answer to that actually straight away. I probably need to give that a bit more thought and to talk to our health partners to see, because this is money that has come directly from government specifically for social care providers. It's not come from government to be spent with health, but we'll have a think about that and a look at that. And then your bit around the groups, it was a national survey that ADAS carried out. We don't get to know which other individual local authorities are part of that aggregated percentage point. However, we certainly know what our like authority, we certainly know what our southwest authorities are looking like, and we can have this conversation with our like authorities. I wonder whether we can go back, Vivi, and ask them for some more information. I can see you wanting to come in now.
Vivian?
Yeah, no, thank you. And I think it's what we do know about the survey results is that we are not in dire straits as other local authorities are reporting. So there are others across the country and even in the southwest that are reporting that they are only able to offer life and limb calls to people, and they are not able to provide the levels of care that we are able to provide. So we do know that it's not a comfortable position at all for us to be in, but we are definitely not in the dire straits end of the national survey that we've seen. So some of those points where it says 13% had to go much further and only offering life or limb care only, we are not in that position. And it does, as everybody said on the call from the service, is that this is a changing picture on a daily basis. Remember, this was a snapshot from Christmas Eve to the first week in January. So this is what was reported at that time, and dynamically everything has changed since then, and it does go up and down. But we are not in the worst situation that some of our counterparts are, even in the southwest. So at the time, you know, people in Plymouth and Bristol were only able to provide those life and limb calls. We weren't in that position. There are some peculiarities of the southwest, which Leslie's touched on in the presentation and are explored in the report, which does talk much more about the sort of working age population, that we have a smaller working age population and a higher rate of older people in the southwest, and we also have a bigger tourist industry, so therefore that does affect the availability of that smaller workforce, working age cohort that we've got. And we also know that rurality in the southwest has a major effect, as it does in Cumbria and other places, has a major effect on what we are able to draw on as our workforce. So all of those factors are being looked at, and the work we are doing with ADAS and the LGA, both across the southwest and nationally, are unpacking that, and we're doing some joint work to really understand how we can endorse it, better understand what we can do to put in place to voice that particularly the working age workforce, and to really get ahead of that game. But it is a long-term plan that we need to get in place, hence why that some of the short-term funding is very, very useful, is very helpful in sustaining the workforce that providers have got at the moment. But we need to think much more long-term with providers. And as Leslie's touched on, the work that we do with our NHS colleagues and our universities and Skills for Care will really help us develop that pipeline of workforce, and also give care the credibility and the sort of career options that are absolutely essential to encourage people into this market.
Can I just follow that up, Jill, by saying,
yes.
So what you're telling me and telling the committee is that we've got about £2.7 million to spend within the next 2 months, at least to passport over to other people, so that it doesn't appear in our accounts. That strikes me as being quite a big ask. Congratulations in advance if you're going to be able to do it. I mean, I remember when we were talking about aid for businesses, and the local authority, our Dorset, received a very large sum of money at the beginning, and then had to hand quite a lot of money back because it hadn't been able to allocate it in a way which complied with the regulations. So, you know, we need to be careful that we don't end up in a similar situation, having to hand back a significant amount of money. So there we are.
Okay, thank you very much, Councillor Legg. Right, I've got 2 more speakers on this part. That's Councillor Rennie and Councillor Brown, and then I'd like to go to the recommendations, but then I'd like to consider the last slide on the slide deck separately, please.
Could I just come in, Councillor Taylor, just
Please
on
do.
that point that Councillor Legg's just made, and just to give some confidence and reassurance. I am confident that we will have spent all that money, because it does get the last thing we want is to not be passporting it to those staff that we're trying to retain. So I think he's absolutely right. It's a big ask, but I am confident that we're going to do it, and I'll come back in March and let you know.
Okay, I think we're about the end of March for the next meeting, so we'll have to have been gone by then. Okay, Councillor Rennie, please.
Well, and hopefully in March, Leslie, you'll be saying we've had a bit more and we've been able to give it to various places. I've got a couple of points, and then Jill, when we come to the recommendation, I'd like to come back again with something else. But a couple of points. It's been really interesting to hear about the staff and all this work done about retention. And a lot of the questions that we've had, interestingly enough, it is around the staff. We could have all the beds in the world and all of our closed hospitals open, but without people to do the care and the work that's involved with those beds, it's impossible for us to actually have people in the beds. And I'm really heartened to hear about all this work that's being done, but a lot of it is long term, and I think we have to accept that long term nature of this. And if there's any plus that's come out of that, it will be that the caring sector gets the recognition for the work that they actually do, not just in value of pounds, shillings and pence, but in professional recognition in what we do. Because it's all well and good saying we've got all these people unemployed who maybe would like to do this. Unless you actually want to do a job, and it might not be your chosen career, but it's something that you are now choosing to do, you're never ever going to be wanting to do it as well, maybe as well as you would hope it is being delivered. I think if that maybe makes some sense, but I think we are on course for a really good long-term future within care and support in all areas of the work that we as a council are able to help deliver. It's a question really, in the slides we talked as well about home care packages, and I wrote it down. The hours now are needing to be longer. We've gone from 13.6, this is an average, 13.6 hours per person, to 20.15 hours. That's, and as you said, that was a significant increase. And I wondered if there's a sort of a bit of a generalisation around why, and also because we're not only delivering to older people who need long-term care, we're delivering to people who are leaving after some major incident in their life, some surgery. And will those 20 hours, in a high percentage of the people who are receiving them, continue long-term as well? Because at the end of all of this, if this happens, we will have more people with more needs having that support to keep them at home, leading useful and productive lives for themselves. So again, it's something we're going to have to plan for longer term as well. So I think that's my question around that.
So I don't mind starting that one off, Councillor Rennie. Again, fabulous question that sort of gets to some of the nub of the problem, and always the way we're dealing with averages, you get a myriad and spectrum of information within that. Breaking that question down into a couple of component parts, that is an average. So we will of course be having people who are having more or less than that care on an average basis, but we have seen that trend since the start of COVID, pre-COVID time, go up to I think it's 20.14 hours is our average per person of new packages of care coming on. So that is not all packages of care, but everyone who starts a new package of care. So that's just an upward trend. And the reasons for that, we can make some assumptions, but we do not have empirical data to be able to support that. We could argue people are being discharged from hospital sooner to help free up the hospital beds, as we discussed at the beginning of this committee. We've also seen people who have not been able to access some of their routine surgery because of the cancellation of elective surgery during that period of time. That could be one of the other factors. People who have been managing those health conditions for a longer period of time without a health intervention could also be a reason for the increase in the number of home care hours going on. Or it could be that actually people, as they start to age and through excellent interventions by health colleagues, people are living longer with more health conditions for a longer period of time. Therefore, it could be a trend that we're going to see over the next 5 years, 10 years, 20 years of people requiring more care to be able to be supported at home well and be a productive member of society. Those are all things that we are currently working through and understanding in our both demographics needs and our pressures as we see going forward. So there's a number of issues with that, Councillor Rennie, that we're working through. On the question about are we reviewing? Yes, we review everyone once they have a care package set up. After normally about 6 or 10 weeks is where we try to go back again to see if people continue to need that level of support. Sometimes it is reduced a little bit if they don't need it. Sometimes it is increased a little bit if it's not sufficient. But generally, we will try to go in between 6 and 10 weeks to make sure that that package we've put into place for people is meeting their needs and it works right for people. But for all of those reasons that Leslie's discussed throughout the presentation, that is hard to do as we're trying to manage the level of volume of activity that we're doing at this point in time. So sometimes those do slip beyond those 10-week periods of time that we try to aim for. I think Vivian would like to come in as well.
Yes, I was just going to say, Vivian.
Yes, thank you, Jill, and Councillor Rennie, really important question. And I suppose what it also points to is the importance of making sure people have got reablement and rehabilitation early, so as in the community, so that people that are able to be supported to get to either after a surgery able to get back to their previous levels of independence, or at least more independent than when they first came out of hospital. That's why that's really important. And also to have reablement rehab in the community available for people close to their homes, so that people do not become inactive for lack of the right therapeutic support, and therefore end up needing surgery, so then go on to that long waiting list that we're all aware of due to COVID, and then that impacts on their recovery coming out of hospital. So it's making sure that we've got reablement and rehab at both ends of the spectrum as we work with people, either beginning to sort of lose some sort of independence in a certain area, such as knees, hips, and falls and that sort of thing, that there is therapy available to people. And if you are going to have a elective surgery for such an event, then you've got the right reablement and rehab in place, so that you can get back to your optimum independence. So that's really important. But there is a reality that the longer people don't receive the right support prior to an acute episode, they are needing to have more support in the community, and we will see that increase over the next years to come. And as Steve says, we are looking and planning for that. That's why prevention is so important early on, that you keep as well as possible, so that those people needing critical intervention, we're able to focus our resources on that, as well as doing a lot of in the prevention space.
Thank you. It feels as well to me that not only do we have to be sure that we've recruited and retained the people delivering, it's the people to manage the delivering as well, to make sure it's there only when it's required and delivered in spades when you need it, but gradually take it off. And it's only having enough people to manage what is being delivered that we will actually be able to control the budgets for that sort of support and enablement. Thank you.
Thank you. The next one is Councillor Brown, please.
Hi. Most of my sort of points have been covered by my colleagues. The mainly an observation is that I know there's been a lot of talk around the retention fund and the sort of the fiscal side of the workforce concern. What I'd like to do is to take this opportunity to sort of stress, I think that we need to be focusing on building that narrative in the community that care is a career people can go into, and that it is a good one to go into as well, because there's so much more to a job than just the finance side of things. Of course, it's incredibly important, but the carers that I've had the pleasure of meeting with, they do it for the love of the job and the love of the people that they work with and for. And when we're looking at this workforce issue, there is the short-term problem with the cost of living. There's the longer-term problem that, you know, we look back through the pandemic, everyone was talking about the NHS and our fantastic carers were overlooked almost systematically. And that's really bad. And I think that says a lot about us as a society, and that's something we need to change as community leaders. Not a question there, Chair, just an observation. And to support work
Okay.
the adult social care team are doing in that.
Absolutely. Councillor Pipe, you wanted to come back?
Yes, thank you, Chairman. It's on corporate parenting. My phone's ringing, so I'm just going to turn it off. Thank you. You know, all of us are corporate parents, and it's a responsibility we all need to take seriously, which I'm sure we do. What would Ofsted expect us and the council to be doing to be graded excellent across the board? Did anybody get that?
We did. If I can respond back, Councillor Pipe, I believe you might be referring to another agenda item slightly further on in the agenda papers.
Yeah.
Okay. I've just put, all right. I've just put a question into the chat bar just on a process. We've got the last slide on the slide deck from Councillor Wharf, which I think it's really important that we should discuss. I just need to know from officers whether we need an additional recommendation to be able to discuss that, because I've just had a thought that we may not be able to go outside of the recommendations at the moment. Can somebody please advise me on that? Okay. It's very quiet out there. Okay, I'm going to put an additional recommendation on here that says that in light of the last slide deck, the last slide on the slide deck, members considered and commented on the role of the community.
I'll second that.
With regards to care. Is that okay, Fiona? Did you get that?
I did, Chairman. Yes, thank you.
Okay, and are we okay from a process point of view?
Yeah, you've got Molly to second it if other members are content with it, please.
Okay, so if other members are content, if somebody's not content, just say no, and we'll assume it is.
Jill,
okay.
You've had Paul Kimber put up an RTS.
Yeah, at the moment we're not I'm not taking comments from non-members.
Yeah.
Can I I'll bear you in mind, Councillor Kimber, but could I bring Councillor Wharf in now? And would it be possible to have the last slide of that deck put onto the screen, please?
Thank you, Steve.
Okay, and over to Councillor Wharf. Thank you.
Councillor Wharf, you're on mute.
Schoolboy error. I do apologise again. I was just saying thank you very much, Councillor Taylor. I think it's been an incredibly positive, constructive debate. I'm really, really pleased that you've come back to the last slide, because I think it's absolutely essential that you challenge what we're doing, but equally essential that you take part in actually what I believe to be the resolution of this. Councillor Kimber asked quite a long time ago, and it was a bit of an open question as to what members should do. And my problem is that what you should do relates to your constituency and your knowledge of your local area, your community groups, excuse me, etc. But I've been thinking whilst this has been going on, and I'm very happy to put together a short briefing note for members to make suggestions as to what they might do and how they might do it, if you think that will be helpful. If not, I won't be at all embarrassed if you say no thanks, it's really obvious. But if you want me to do that, I'm happy to do that, Chairman.
To be quite honest, Councillor Wharf, that was going to be one of my asks, because when I looked down that list, I look at it and I say, okay, I'm a chair of a community group, but it's not the sort of thing that I think my community group would want to take on. Also, I'm parish councillor, and I'd like to know what you're actually asking parish councils to do.
Okay, well, I'll Councillor Taylor, I'll certainly do that. It might take a couple of days because I want to put something together that is coherent and makes sense rather than just think about it. And I want to perhaps test it with perhaps yourself and a couple of others before I send it out. But I will do that in the next 2 or 3 days if that's okay, and I will send it to all members, not just your group, if that's okay.
Yep, that will be really helpful. Thank you very much.
Thank you.
I'm going to open it out for questions now on this part, but I'm going to use whatever to take my question first. Just looking at the amount of carers that we've got who are unpaid carers and the support that we give to those, I was quite surprised actually just how many we've got. If you look on I was looking on the the Carers Support Dorset website, and they were saying that around about 11% of people are caring for somebody unofficially. Now, these are the people that we need to be in place. We need them to have some resilience. And I'm just wondering, looking at numbers, because there could be anything up to about, I reckon, about 500,000 of them out there, on the support that we give to them and how we can support them better. I'm just wondering whether there's any thoughts on that from officers, please.
Shall I come in first of all?
Yes, yeah, please do, Leslie.
Thank you. I think you're absolutely right to raise this, Councillor Taylor, and you're right on the website. I hope all members have been able to, are familiar with the service that is delivered and are familiar with what is on offer. I think there's always more that can be done. I think that the forthcoming carers strategy will be part of a discussion once it's been to overview and part of a discussion here. But also I think that the event that was held on the 25th of November also highlighted the significance and importance and the value that we need to place on carers locally. We had a conversation about whether it's helpful, because it is an ongoing national issue as well, supporting carers, because the ask is certainly to ask carers to do more, whether it be helpful to do more work as a committee with that carers organisation and with Health Watch themselves as well, and a forthcoming survey that they're doing, which Vivian might want to expand on actually. Shall I hand to you, Vivian?
Yeah, no, certainly. So some members may be aware that Health Watch and also Friends of both acutes are doing surveys into people's experience as both carers and also as part of the hospital discharge programme, to understand what has the experience been like for carers and for people coming out of hospital during the COVID period. And they are gathering that information at the moment, and we're joining that up with information that our own carers organisations are compiling. So that will be a wealth of information that will really give us a clear understanding of where we can better support our carers, and where they want us to step in and take some more responsibility for, where they need to lead themselves and want a much clearer support, but and they want to be really clear about what their requests are, and where when things have worked well and when they haven't worked so well. We are going to spend some time looking at those surveys to really understand that, so that our carers offer across both social care, the council, and across with our system colleagues, we can better support carers. And as in this presentation, Les touched on that we are providing carers with direct payments for people they care for. Whether or not this has helped, hindered, or people want more of that, is part of the brief and assessment that's going to be pulled together. So this committee may well want to look at the support that's provided for carers in the round and some of that feedback from those surveys.
Okay, Steve, and I've got
Councillor
Molly
Taylor.
wanting to come in as well.
I was just going to add to the information that's already been provided. So from a Dorset Council offer directly to carers, so each and every person that comes to adult social care who maybe a loved one or a relation has a assessment, we do have a full carers offer that is provided alongside the statutory social care assessment. We do provide a carers assessment, so it is down to the individual whether they do or do not take up on that, but we have a fairly extensive both information, advice, signposting and direct support offer to unpaid carers that goes alongside the support we might put in for a cared for person. So that might be financial advice, it might be advice around access to other benefits, it might be advice around respite provision, it might be a fully paid direct payment service that supports them in their caring role, potentially that they can use as they see fit. So we do have a internal statutory offer that we provide to carers in our community as well. And as you say, there are a number of very valuable, hugely welcomed unpaid carers that are operating across Dorset that we see as a really valuable thing that goes alongside our paid care workforce in helping provide really good support to people.
Okay, could I go to Councillor Rennie, please?
Yeah, thank you. This touches on what I wanted to bring up around the recommendation and also the comments from Councillor Wharf as well. What can we do? And normally we would have a scrutiny request form filled in and handed in to yourself, Jill, but maybe part of the recommendation could be that we actually form a task and finish group that sits alongside all this piece of work that we're doing, because this will come back in March. It'll come back again this year. It'll come about next year, because this is not just about COVID and Omicron. This is long-term support, not just for people who are taking care of people as they become older, but it is to be enabling people to come out of a hospital sooner and, as I said earlier, to live productive lives sooner as well. So I'm wondering if we should be forming as well a task and finish group that maybe meets with, I wrote down Dorset Carers, Hold First Programme Board. Leslie's mentioned different boards that they meet with, providers, different people, a bit like on the lines that we talked of with our housing providers. I don't quite know how we deliver it and how we do it, but a similar sort of task and finish group within this scrutiny committee.
I think that's an extremely good idea, and it's in line with the advice we were given last year. If we've got a paper coming like this, it may be worth our committee doing a little bit of work so we can feed into it at an early stage. I don't know if anybody else has got any other opinions on whether we should set up a working group on this or a task and finish, and whether officers have got capacity to help us should we want to. Can I just ask on the capacity before we go any further?
Yes, we can absolutely commit capacity to help with this.
Okay, so could I ask members whether this is something they would like to do, and if so, shall we take it forward? I personally am very much in favour of it. I think it's the voluntary carers that are going to be more and more under pressure from this, and if we can use voluntary carers a lot better and more effectively and support them in a lot better, it's in a lot more effective way, we are going to make a difference to this. Any comments from anybody?
Jill, just to support that really, and I think, you know, I mean it's often said and can't be said enough, is that they are the backbone of what keeps people safe, and they are the majority of care that's provided. So I think it would be invaluable to look at the responses we've had and then develop this into a programme of work. So I'd really support, and I know my colleagues, officers, would support that task and finish group to pull this together to feed back into a future committee.
Okay, right. What I'm going to do with...
Can I just go back as well? Beryl has also mentioned a member briefing, and that also might help along with Councillor Wharf's call to arms, he called it, but also along with this sort of work as well. Because if we're going to ask members to help in any way, we need to have more of them on board other than the people at this committee. That's
Okay,
been
so,
done.
okay, so I think we'll take it away. We'll set up a working group. I'll certainly drive that, and we'll look at membership of it over the next couple of weeks. I've got Mary wishing to come in.
Thank you. Thank you. No, I was just going to say that I agree with what you said. Yes, definitely to set up a group.
Okay, have you got capacity to come and join us?
I'd like to join. Yes, thank you.
Okay. I've got two non-committee members wanting to talk. Is it on this subject? So I've got Councillor Taylor and I've got Councillor Jesperson. Councillor Taylor?
Yeah, thank you, Chair. Yes, I totally agree with what you're saying. I think it will be all calls to arms is a good question, actually, and to bring us together, because I would love to help this, because the fact is we are all heavily committed to our communities, and I have many parishes, and it's a question of making sure the word is out there. So yes, I would love to help if that's of any help.
Okie doke. And Councillor Jesperson? No need to speak. Okay, she's just supporting. Right, so I'll take that one away and have a look at it. And I'm assuming, Councillor Rennie, you would like to do this as well.
Yes.
Councillor Wolf.
Thank you, Chair. I'm very happy to play a part in that. I think it's an excellent idea. I'm happy to organise or lead or otherwise a members' seminar, which I think was Sherry's idea, which I think would be quite a good way of kicking it off. But I think a member group, in order to just put some scope on it to start with, would be better rather than just starting a member seminar with just what could end up sounding a bit like platitudes. I think we need to get some proper sort of stuff around it so that we know what we're doing. So I'm happy to do that. I'd like to be involved, and then I'm very happy to lead or take part in a members seminar or let you lead, whichever you think better. I would just add a point that it could be that the overview committees might feel that they want to play a part in this. So I think we need to be careful to involve everybody in it. Thank you.
I'm quite happy to look at a membership that is representative across the council and across the committees who need this. So I'll take that one away with me now. Any other comments? Councillor Kimber has come in that he's happy to help as well. I think we need to wrap this part of the discussion up. I think we could talk for ages on what members could do, to be quite honest. But I think that is something that we need to feed into officers, because we could be here till 3 o'clock this afternoon. So I'm going to call an end to this part of the discussion. I'm going to move the comfort break forward. It was meant to be after the Ofsted feedback. I just need to check with the officers who are available for Ofsted that they'll be okay to present in about 5 minutes, say, if we have a break until just before 15 minutes past 12 and come back. Is that okay, Sarah? Can I just ask you if you're okay with? Okay, if it works for you. Okay, I'd like to thank everybody who's been on the call for the care sufficiency part of it, and I'll see everybody back at about 12:15 if that's okay.
Yes. It's perfectly okay. Jill, hello.
Hello.
You all right?
Yes, yep.
I was very pleased after.
Molly,
Molly,
Fiona
I think
here. Sorry,
we're
just to tell you
still
we're still
online.
live.
We're
Sorry,
still
Fiona.
live, so I'm going to continue the meeting now. It's 12:15. So I'd like to go on to the Ofsted feedback paper, and we've got Councillor Parry here and Sarah. We've got a short, I think we've got a short presentation on this. Have we? Or are we going straight into the discussion? Okay, thank you very much. So we've got the Ofsted report from the inspection that we had late last year. Would you like to say anything, Councillor Parry, about it?
Thank you. If I may, Chair, just as a way of background, you'll appreciate that this has been quite a long journey for Children's Services to get to a very welcome point. And if you look at where we've gone through the local government reorganisation, the blueprint for change, which created the framework for the new Children's Services and the locality model that came with that. And then, of course, the pandemic, which, as we know, caused huge pressures on the service. We must acknowledge the pressure that created, and then to come through all of that, and then find ourselves the subject of a really rigorous scrutiny by Ofsted of Children's Services, which gave us the outcomes we see today. And we set out to be bold and ambitious, and we set out to deliver good and outstanding services for the children and young people that would be recognised by Ofsted. And this report does reflect much of that information. But we are not people that rest on our laurels by our nature, and the report makes it very clear there is more work to be done, and we are very much in that mindset of delivering on those priorities. I know Sarah Jane will talk to you about the technicalities of it, and I know members will be very keen to ask questions and to understand our determination to deliver for the children and young people of Dorset.
Okay, thank you very much, Councillor Parry. Would you like to add anything, Sarah, or would you like me to go straight over for questions?
Thank you, Chair. Just to recognise that I'm here today deputising for Teresa Levy, who's our Executive Director for Children's Services. And Councillor Parry was able to give a really good summary of our Ofsted inspection. And just to recognise that we are rated good overall, and that's good for children in care and care leavers, good for children in requiring early help and our help, children in need. And outstanding for leadership and management, and just a huge recognition really of the work across Children's Services and across our partnership. And I'm hopeful within the report what you'll see, just as Councillor Parry has said, is that relentlessness really for us to keep on moving, and we have kept on moving. Obviously Ofsted left us, we welcomed them late September, early October, and they left us after that point. And we've continued to make our journey forward, and to be ambitious and aspirational for our children and our staff, who of course are just as important to us, and to really think hard about what Ofsted told us. And I'm hoping in section 14.3 you'll see there those important next steps for us, and what you'll recognise there is we're talking about continuing with work. So we were really grateful for the scrutiny that Ofsted gave us, and we were pleased to see that they could see where we'd made really significant progress. They could see all of the plans that we had underway, and they could see the direction we were heading in. And I think what's laid out there is really just confirmation of that direction. We continue with our Strengthening Services Board, which is actually our Good Getting Better board, and we know that we have all of the ingredients to make sure that our services are good and outstanding and continue in that way. So just recognition really of that, those next steps, which are all important, and then happy of course to take any questions. Thank you very much.
Okay, thank you very much. I mean, first of all, I have to say it's a really good report. These sort of things are always quite worrying when you've got an outside body coming in to look at what you're doing. But I think it's really good that it's such a good report. I'm going to go first of all to non-committee members and then to committee members again. So, Councillor, where are we? Councillor Taylor.
Thank you, Chair. Thank you, team. I would like to personally congratulate you on the report. It is outstanding, and it's a pleasure as I sit on the foster panel to see the good work that we all do. And it was very heartwarming to see outstanding as well as good, and I was very, very proud. And I'd just like to say thank you very much and well done.
Thank you. Councillor Jones.
Yeah, I'd just like to congratulate everyone as well. I think since the council came into being, there's been such progress made on children's care and families' care, and I think it's wonderful your commitment that children and young people will be involved in everything along the way. It's so important to get the voices and the opinions of the youngsters and not just to listen to adults. I think that's very important.
Thank you very much, Councillor Jones. I haven't got any more non-committee members wanting to speak. Can I go to Councillor Gorringe, please, as a committee member?
Thank you, Chairman. Yes, it's a very good report. My question is, to what extent did the blueprint for change, reorganisation and locality model help achieve this outcome?
Councillor Parry, would you like me to take?
Oh yes, I'll deal with the politics of that. You will recall that any form of reorganisation on scale is quite challenging. I believe my screen has now frozen.
No, I can hear you.
Okay. Yes, any reorganisation on scale is incredibly challenging, and that is a journey that you have to take. Not only our own officers, many of whom will find themselves in new roles, and some, of course, chose to leave the organisation, but also our partners, because it required new ways of working. And one of the things was the strength of the locality model, so that when we look at things like the importance of educational psychologists inside every locality, that really was a core part of what we wanted to achieve, and was directly from the feedback we'd had from the schools, for example, that they saw the importance of us putting necessary measures in there to support things like speech and language, for example, which is a very important area in children's services. The locality models themselves, you know, that they all have their own individual characters, and in some areas, in for example, the Chesil locality, we put additional support in there in recognition of particular local needs, and that's something that we're able to do as part of the blueprint for change. But I having been through that whole reorganisation, I think it's quite nice to find us for a moment in time enjoying that locality in a settled environment. Inevitably, there will be further changes down the line as new legislations and the like make themselves forthcoming, and we have to adjust to those and the needs of our children and young people and their families. But operationally, I'll leave Sarah Jane to discuss the blueprint for change.
Thank you, Councillor Parry. So what our staff and our families are very clearly telling us is that the locality approach is really positive for them and works very well for them. And Ofsted, again, were able to take a view. So for us, it was really helpful to have that view. Ofsted underlined the success of that, just as Councillor Parry has outlined. So bringing those services into a conversation together has been just so very important. And to the point that colleagues across the country are asking us about the model, asking us to have conversations with them as to the strengths of that model, really. It's created quite an energy, really. But what we know is that we stay true to our model. The locality works very well for our children and their families. And, you know, as our staff will tell us, it's working very well for them also and for partners. Thank you, Chair.
Thank you. Is that okay, Councillor Gorringe?
Yes, thank you very much, Sarah, and thank you again, Councillor Parry.
Okay, and the next one is Councillor Rennie.
Thank you. I wanted to actually just pick up on, we've already within this panel, within this committee, we've looked at fostering, and there was a very good comment in here. Most children in care live in foster families. Foster carers are recruited, supported and trained by experienced and aspirational social workers who support them to understand the trauma that children may have first faced earlier in their lives. I was really pleased to read that, especially as, again, the trauma around domestic abuse comes into this, but not specifically for that reason. But when we have David Bonner's report a bit later on, some of you may have picked up the need for more foster parents and foster carers. And again, these sort of remarks are really, really good to show support to prospective foster parents and them to understand what a good local authority they're working in, and that they will receive all the care and support that they're going to have. And again, picking up on Sarah Jade's comments around locality team working, because this comes up under the Strengthening Service Board, tracking the progress in some of the areas. And I'm really pleased to see this work around the continuing work around domestic abuse and VOG work, women and young girls. But again, this trauma-based approach to children living in families with the impact of trauma on their lives. Thank you, excellent work. And I just think I'm proud that I'm part of this team that has changed the lives of so many children just in the 2 years, as Stella mentioned, just in the 2 years. So thank you.
Thank you.
If I may, I would never miss this opportunity, as Councillor Rennie has given me the golden opportunity to promote the need for us to recruit more foster carers in Dorset from a diverse range of backgrounds. We would welcome your inquiries. We want to support you. The more foster carers we have, the better chances we have of making those really important matches for children and young people who are in our care, giving them the very best of outcomes to come. So thank you, and massive thank you to Molly for everything she does in the area of supporting those who've been victims of domestic abuse. And that, of course, sadly does include far too many children and young people.
Can I just add to that as well? We have got a paper coming in March on the fostering service, and I'm assuming that is still coming. So that would be really good for Scrutiny to have another look at that. Is that still okay and still on track, Sarah? Just checking.
Councillor Taylor, we can absolutely bring that forward. We've got that in our line of sight for March, and it will be an update on all of the work that we've been doing within our fostering service, and will complement very much what Ofsted also found. Thank you.
Okay, that is brilliant.
Sorry, I can assure you, Chair, you'll find Jerry, our new fostering manager, champing at the bit to tell you about the work that's going on inside fostering.
Okay. Councillor Pipe.
Thank you, Chairman. I refer to my earlier question. You know, all of us councillors are corporate parents, and it's a responsibility we take very seriously. What would Ofsted expect us and the council to do to be able to be graded excellent across the board? I know we are rated good now, which is a huge achievement over previous years, and my thanks go, of course, to the team that and the leadership which actually achieved that Ofsted grade.
Thank you. Shall I do the politics? Okay, thank you. Bill, you'll know, as I found out, when you become a councillor and somebody sits you down and explains to you what your role is as a corporate parent, my goodness me, that's a serious responsibility that we have to take on board. And I'm really pleased that actually we've tended to work on a one council approach on how we meet that. That's so essential. But some of those things that Ofsted, I was able to explain to Ofsted when they asked us the questions of us, is, you know, that the importance of our webinars in informing members of how we go about decisions inside children's services. The fact that members are coming to us very early on with concerns involving a particular child and family in their ward, and we're able to liaise through the locality models in order to the locality teams to understand if this child's needs are currently being met, or how they can be, or whether we require a further team around the family model, for example, of support for them, those sorts of things. So, and I know it's given us the opportunity to better inform members, but also when we come to things like our scrutiny committees and our overview committees, the challenge that we get from members. You know, it isn't just a box ticking exercise. It is something that we are living and breathing and we practice on a daily basis, is our commitment to be good corporate parents and looking at ways that we can deliver that. So I know we have been working with Maddie Hall, for example, on a programme of work of training and development for members in response to corporate parenting responsibilities. And I would please encourage every member of council to get involved with that. That's so important to us. Those are the ones that sort of come to my mind. And the other one I've noticed is of course that members have been very respectful of confidentiality of information around families, because sometimes we do need to have difficult discussions, and I'm very pleased that members do understand that.
Thanks for that, Andrew. Yeah, I recognise many of the points that you make there, as my previous time spent on the corporate parenting board under a previous regime. So thank you very much for that. Thank you. Is there anything that any of the officers would like to add to that?
Thank you, Councillor Pipe. If I may, just to echo obviously what Councillor Parry has said, we are really fortunate to have such energy with members who are right alongside us, giving us good scrutiny and challenge, ideas and support really. Today we are corporate parents to 431 children in our care, and it's a responsibility that we all take really seriously. And our corporate parenting board, in answer to your question, how will we get to outstanding across the board? Our corporate parenting board will not let us rest on our laurels, even if we wanted to, which of course we don't. But the level of scrutiny in that board, and also our care leaver delivery group, it's really fantastic in the way that everybody, the partnership, is really wanting the very best for our children and young people, and the dedication to making those very important actions that we talk about there, which are actions for us but actually make a real difference to our children, to make those a reality. That commitment hasn't faltered, and if anything has just got stronger and stronger. So it's just that relentless keeping on doing what we do well, building on all of the things that we know we can build on, and really working across the partnership and into our communities, particularly for our care leavers. That's what will give us that real strength, and we'll make sure that we reach those next steps that we want to for our children. Thank you.
One of the most satisfying parts of the old corporate parenting board was when it was time to talk to the care leavers, see what their expectations are to be going out in the big wide world, albeit possibly under in local authority accommodation or sheltered accommodation, and the extent to which their hopes had grown so much while they'd been under the care of Dorset Council was really encouraging, and it's an excellent service in my mind, and I do hope before the next Ofsted that we can actually manage to up our game a bit to the outstanding. And I say it again, well done everybody, well done. Thank you all very much.
Okay, thank you very much, Councillor Pipe. Councillor Legg, please.
Yes, thank you very much, Jill. I'm looking at page 66 of our agenda and to the Ofsted report, paragraphs 26 and 27, where it talks about the options for care leavers being limited. And it says oversight of these arrangements is not sufficiently robust, particularly in terms of visiting arrangements, supporting young people and everyday needs, and seeking alternative housing. Now, it seems to me, if you go on to read paragraph 27, that we've been doing quite a bit in relation to seeking alternative housing. And I suppose the question to ask there is, how far have we got with that? Because obviously this report was written sometime late in October, I guess, since they visited on the 8th, according to the note at the bottom. So what progress has been made in relation to the alternative housing that you are seeking, and the two other elements about which the Ofsted report was not quite so happy. What about the alternative visiting arrangements and support for young people with their everyday needs? What are we doing in that sector?
Thank you, Councillor Legg. If I could take just an initial response to your questions. Absolutely right, and Ofsted left us with that one action to make sure that we have really good oversight of our care leavers if they are in temporary accommodation or emergency accommodation. And I can see Andrew Billany has joined me in this, because what's really important to acknowledge here is that this is a real council approach to making sure that we have the right provision for our care leavers. So you'll be aware we've got Curtin Avenue in Weymouth, which is coming online hopefully very soon for 12 of our care leavers. And what we've been doing between myself and Andrew and the people who we work with is really thinking about broadly where could those accommodation options be for young people. So we're talking about increasing our supported accommodation within our own care leaver and fostering service, but also working with Andrew and his team who are working across their contacts, the landlords, housing associations, to really make sure that our care leavers are given the right priority if they are finding themselves in a situation where they may become temporary homeless, and that we have, my words, we have no tolerance for that. We make sure as a council we step in and we are corporate parents and we do the right thing. So we already would act as guarantor for our young people if that's the right thing to do. I just wonder, Chair, if it would be helpful for Andrew to come in at that point, if that's possible, just to give a bit more detail around that. But just before that, to say that we are overseeing to make sure that for our young people maybe who are feeling more vulnerable or life has just become trickier for them, we make sure we're right alongside them. We have enhanced visiting by the care leaver team, by their PAs, and also by partners. And we're keeping a real close eye to that, but also staying alongside young people who aren't in the accommodation we want them to be, to make sure they get to where they need to get to. Thank you, Chair.
Would you like to come in, Andrew, and make any comment?
Thank you, invited. Yeah, Sarah Jane said most of it actually, so that's a sign of good joint working. But I'd just add some practical detail around what's happened. The question around what's happened since Ofsted. We've always been working closely together, but we're doing some particularly focused work around very much outcome action focused work around. For example, currently there are two care leavers in their 20s, but there are still care leavers, corporate parent responsibility, or in bed and breakfast accommodation at the moment. So we're meeting actually this afternoon, aren't we, Sarah Jane, around just getting specific action plans to clear that position and to make sure we're not in that position. So we're improving, but we're not where we need to be yet. I'll just slightly repeat the same point though around that Sarah Jane's been made. What we'd stress to members as well is about making sure we're broadening options as wide as possible. So we do have a range of options for people, for care leavers and all of our young people and families across the piece. So with part of the, it's been mentioned earlier on, part of the developing housing strategies to really look more broadly than we perhaps have in the past, where we looked at our registered provider provision only. Whereas this very much looks at really what is going to provide people with choice and the best range of options as young people as well as care leavers. So we're happy to come back to that at a later date, but I'd support the description Sarah Jane has given, and we are focusing on really some outcome details. So we are producing for those individuals.
Can I just respond to that, Jill, by saying,
please do.
I mean, I'm just conscious of the fact that there was a supported living premises in Sherborne for young adults, which closed a few years ago, and recently a planning application has been submitted by the presumably by the previous registered provider to turn it into upmarket flats, and I'm just wondering whether we're losing the availability of accommodation of that kind, and where we stand now as opposed to just a few years ago when it was there. I mean, you can't actually base what's happening across the whole county on what's happening in your own backyard, but I'm just wondering, where we are with this. Are we aware of registered providers closing down some accommodation because they can no longer afford to run it?
Shall I answer that, Chair, just to come back?
Yeah. Yes, please do.
Thank you, Councillor Legg. I'd need to know more detail about the particular case in Sherborne, but I'd say generally position is about how we talk to our registered providers, and also Homes England, who fund a lot of what they do, is to highlight the need for this area of work. So we are talking to them, and conversation with Sovereign only last week around them being keen and very willing to develop exactly this kind of accommodation in their future plans. So the intention and the willingness is there, but I need to know more detail about the circumstances of that particular closure, because I'm not aware of it, I'm afraid.
Okay. Have you got anything to add to that, Sarah?
Nothing to add to that from me.
Okay. Is that okay, Councillor Legg?
One thing, if I may just say, Chair, in response to Councillor Legg there, is he will recall joining us in a vote at Council for a council tax exemption for care leavers in the Dorset Council area. That in itself would remove one less hurdle removed for the young people who are exiting or transferring across from being in our care to living more independently. And that is a policy that we continue to support, and we further ways we can further that. But it's a very positive example of trying to remove one less barrier in a young person's life to secure and suitable housing.
Okay, thank you. Okay, I've got two questions myself. One is on the action plan, and I note on the action plan that all of the recommendations have got closure dates that are fairly short. So a lot of them are actually today, and a lot of them are the end of March. I'm just wondering, is that intentional because that's an Ofsted requirement? What I would like to, that is, I can see Sarah nodding her head. But
it's one of the same thing. I can answer that if helpful. We have to submit our Ofsted action plan by the 2nd of March. So what it's showing to you is that we know what the actions are, and we've nearly completed all of them, which I think is a really positive statement for us to be able to make. We do have our annual conversation with Ofsted as well, which happens in March. So we'll be able to evidence that what they found, where they felt we just needed to make some progress, we've absolutely heard that, and we've been making that progress. But also wider actions that might come from these. So these are very particular actions where we know we've taken decisive action, so to speak. Anything that's larger may take a bit longer, are things that we've got in our line of sight for the Strengthening Services Board. So this is absolutely right that we have nearly completed on all of these actions.
Okay, so there are some longer term actions. Just coming back to Councillor Pipe's comment on corporate parenting and making it outstanding, and there's obviously plans in place. I can see you nodding your head. So there are plans in place to maintain the standard that we've got and also to take it forward. My other question was around the Strengthening Services Board, because this was put in a couple of years ago when Children's Services needed improvements, if I can be quite, I don't know whether that's the right way of putting it, but I'm just wondering what the future of the Strengthening Services Board is. Is there intention of keeping it going long term? Or is it looking at having a review of its terms of reference, or where is it going at the moment?
Thank you, Chair. I can answer that for you. So we still have the Strengthening Services Board. It's been a fantastic partnership mechanism, really, to get some real traction and pace on the important things that we need to do. It wouldn't be a Strengthening Services Board. I think Teresa is very keen that we call it Good, Getting Even Better board, so something along
Yeah,
those lines. She'll come back to you with a definite on that. But we want to keep it in place, not only because it keeps that great partnership working within it, but also it works as a bit of a mechanism to work into the Pan Dorset Safeguarding Board. So we have some place-based arrangements within Dorset for our safeguarding, and what partners have recognised with us is actually this board works quite well to be able to inform the safeguarding partnership. So we would really want to keep that. It will have a review of its terms of reference, and it does have a new action plan which has been highlighted here as to the things that we need to take forward. Works very well across the safeguarding partnership, the CSP, so all of the mechanisms that you would expect, but it keeps a really good eye on what we're doing, and we'll make sure that we keep on track.
Okay, that's brilliant. I haven't got any more RTSs in the chat bar, so thank you very much for coming and presenting. I don't think we have a decision to make other than we really noted it and considered it. So thank you very much, and keep up the good work. So
thank you, Chair. Could I just offer, we are undertaking our self-assessment for Ofsted, and if it would be useful for this committee for us to bring that back here, it will be completed in April. So any time after that, we could bring that back here for further scrutiny and discussion would be helpful for us.
Yep, that's absolutely fine. I think our meeting after that is about June time. So if you could talk to oh gosh, I've forgotten his name. I'm sorry. George. And George, our new committee clerk. That would be really helpful. Thank you very much.
Thank you.
Okay. And if we can move on to the next item, if I can find it on my agenda, the complaints.
Sorry, Chair, I have a question.
Sorry, who was that?
David Taylor.
On the, yeah.
Just what we've been discussing. I'm intrigued by the report. Can I speak?
I think we've probably lost the officers now.
No.
Oh, for complaints, or
no, for the previous article, just to say the fact is that the improvements that we're looking at with the fostering care and services. Is there a opportunity of councillors like myself being involved so can we actually discuss it to see we're going in the right direction?
The fostering work will be coming back to our committee in March anyway. We've got a paper on the fostering services, so I think that would be a place to input into that. Unless Sarah, I see you've come back, which is really useful. Unless you've got any other.
I was just thinking about it, thinking, hang on.
Is that right, Sarah?
Press the wrong button. My apologies. Yes, absolutely. So the 14th of March, we'll be able to bring that report forward and support that conversation.
That'd be fantastic. Thank you very much.
Okay, brilliant. Right, if we can go on to the item 7, corporate complaints team annual report, please. If I could have a really short presentation on this, and we are very overrunning, so I am sorry, but really the shorter the better, please. Thank you.
Of course. Thank you, Chair. Thank you, councillors and members. I don't do short about complaints very well, so I shall try my best to give you the briefest possible overview. This is the report from 2021. So we're 10 months on now in the life of Dorset Council, and I look forward to telling you a little bit more when we have more time in the future about some of the strides forward we've taken. But I think it's a really good opportunity to look at the key numbers and scrutinise by all means, but mainly reflect on possibly the most challenging year that I've experienced at Dorset Council. And funnily enough, when I look at my original profile picture and then gone to the live camera, I realise what 2 years in complaints has done to me. We're, to cut to the chase, we're 96% up. Sorry, forgive me, we're 76% up year on year pre-COVID to 2021, which is a tremendous leap in volume. So 76% across the board. I've missed an opportunity to introduce myself. Sorry, Chair. I'm Tony Bygrave, and I'm responsible for the complaints function at Dorset Council. So we sit in assurance in legal and democratic. It's a very small team, and we look after and manage all of the complaints processes that come through Dorset Council. So that's for children's social care, statutory, non-statutory, adults, councillor conduct, and the corporate complaints process that we operate as well. So we're quite busy, but the main objective for the team is to be a critical friend that encourages a little reflection, a little bit of learning and demonstrative action from complaints. I think it's really important that Dorset Council as a learning authority take the opportunity to self-assess the service we provide, and Dorset Council's complaints team are the independent eye to do that. So I think it's very important that it is a corporate complaints team and an assurance function at the end of the day. So the key numbers, you'll note that Q1, when sort of COVID first broke, was quite encouraging, wasn't it? And I think you can go across the directorates and you'll notice the sheets with the various coloured blobs on from Q1 through to Q4. You'll notice it's pretty consistent that at Q1 the compliments were up and the complaints were down. And I think the initial response to COVID, the public sentiment was quite encouraged by it. And I think quite quickly as we go through Q2 to Q4, I don't think the efforts of Dorset Council were any less, but I think public sentiment had become a little more negative because of people's own individual circumstances. We saw a great increase in the Place Directorate because there were services that people could see and people found themselves at home more, working from home. And I think for social care, I think people had more time to perhaps reflect on their own family circumstances or services they may have received historically, particularly for children's services. We were seeing cases that we were revisiting and not always the voice of the child through the complaints process. We were hearing the voice of the child, no mistake of that, but the complaints process itself perhaps wasn't being used to that end. I think it was more so the parents and perhaps some of the records that were held. Timescales, you'll notice, was quite poor. We aspire to deliver within 20 working days on all of our processes. The complaints team themselves were asked to be redeployed at 2 different times during this report, and I think that, with the exception of the statutory timescales, which were still being monitored, we essentially just were unable to deal with complaints, and it was considered not to be the priority at the time. And timescales were in some cases being missed before we'd even managed to get them to managers because we had no staff in the complaints team. But the biggest stride we've taken this year is to address the resource issue there, and to my mind take complaints and learning from complaints a little bit more seriously. We were backed by senior leaders in terms of resource, and I'm really encouraged now that we are delivering learnings more. We've got capacity to close the loop more with the quality assurance side of it, for particularly in adults and children. We're feeding back in to make sure that challenge and those actions are being delivered. And I think at the time of this report, 2021, what you're seeing is probably a reactive firefight in relation to unprecedented operational circumstances. What we're seeing now, and I've very much got my Q3 hat on, is the same volume of complaints coming in. Make no mistake, the complaints are still coming in at the same volume, but we've got a team of people now that are actually able to deal with the demand and support the directorates and the heads of service there. And in short, the message is getting back at heads of service level, and we are working together. Colleagues were mentioning one council. I'd absolutely applaud that, and I am genuinely seeing evidence of that combined and united working of Dorset Council. There's no doubt that that's happening now, and I, from my own personal experience, I'm really enjoying playing a rather small part in that. But I think the complaints team provide a little bit of mediation, a little bit of reflection, and as a critical friend, hopefully make it slightly less painful in dealing with sentiments that are sometimes quite negative, without losing the fact that a lot of the time people have got a point. Are there any questions?
That's lovely. Thank you very much. Just a moment. Councillor Spencer would like to come in, and then actually, if I can just interrupt beforehand, could I just have approval from the committee to take this committee meeting over the 3 hours, please? If anyone doesn't want it to go ahead, please put in the chat bar. Otherwise, I'll assume everyone is in favour.
I'm going to second for you, Joe.
Thank you. Okay. Right, if we can carry on. Sorry about that. Councillor Flower, please.
Thank you very much, Chairman. Well, Tony's given you a very crisp, comprehensive overview of the current situation. And I think I can't add much more to what he said, to be honest, other than to say to him and the team, now it's resourced. We're doing a really good job. It's an important piece of work, this, Tony. Don't underestimate the importance that you play in improving the quality of the services we deliver for Dorset Council. This is not just a case of accepting a complaint and dealing with it. It's a case of learning from any complaints that are valid that we can do to improve our service. You play a key role in that, and the team, so really well done on that. And I love the term critical friend with a degree of sentiment. I'm 100% behind you on that one, Chairman. I'm not going to take any longer. I'm going to use brevity as a way of saying thank you very much on that particular report.
Okay, we haven't got any RTSs coming in. I've got a couple. I'm a little bit concerned about the lack of learning in some aspects about this, because part of complaints is all about learning. I don't know whether you've got any comments on that. And also, my other comment was about, do we benchmark against other councils, and how do we fare with other councils?
Really good point. I think with regards to the learning, there was a resource challenge in the team, and when the two occasions in the year where the service didn't exist at all, it's very difficult to pin down specific learnings from complaints. We continually do so through challenge. We quality assure all of the responses that go out the door to make sure that they're fit for purpose, they're fair, that they don't miss the point, and they're completely robust, so we minimise the opportunity of any reputational damage. So that service is provided, and if we feel that the complainant has a point or there are actions, we very much make people aware of that. And I'm really glad that and was very heartened by what Spencer said. Thank you, Spencer. Absolutely, the investment in the team, I think, will be a lot happier this time next year when you actually see what we've done on the tin. The quality and the learnings and actions are really there to be seen, and it's actually quality rather than just numbers that they're actually fed back into the quality assurance team. So we're really going somewhere with it, but I think you're right to flag it. Also bear in mind that the report is not exclusively social care. There was quite a lot of observational planning stuff in there. There was highway stuff in there, and some of it, or perhaps adult finance, which is a little bit more yes or no. It's a question of, were matters considered fairly, but sometimes the outcome was a yes or no, or it was a service request with a little bit of extra gusto. So to my mind, every complaint can provide a learning opportunity, but some more so than others. And if they are cries for help or requests for a service, no, not cries for help. I think certainly requests for a service, and if it's a service that we deliver and people just want a positive outcome quickly, there isn't always a learning opportunity in quite the same way as there might be something that promotes reflective practice. But it's a good point. The numbers are lower than you would hope on a percentage basis, but I'm a lot more confident that this time next year you'll see improvement, just mainly because we've got the staff now to make the challenge, which we didn't have at that point.
Okay. And
the other point, yes, you mentioned a comparison to other councils. We should be really positive, actually, and I should have mentioned it in my overview that essentially the independent eye of the Ombudsman provides us with really good oversight as to how well we're doing, and our proportion of complaints which are upheld by the Ombudsman really very positive, and I think we should be really heartened by that. So the figures, I've not got them to hand, but the LGO do provide figures for all local authorities. One of one which will remain unmentioned upheld 70% of their complaints that went to the Ombudsman, and we upheld about 6 in 2021. And yes, there's an argument that we should be aspiring to more than that, to less than that rather, to deliver the perfect service. But I think we should be heartened by the independent eye of the Ombudsman and their lack of findings against Dorset Council. In essence, we're doing a really good job.
Oh, that's brilliant. Thank you. I think I've got Councillor Rennie asking a question now.
Thank you. It's a comment, really. I sat into place Scrutiny the last week before, and that was really interesting as well. And in fact, I think you got off in with a lot more questions there. But one of the points that were made was the fact that councillors' roles in not fielding off complaints, but sometimes it's really easy to say, well, you could complain. And I wondered, because I see councillors' roles as being part of that team and enabling people to find a route themselves as well to get something achieved. But so often, if people can't get what they actually want, that brings about a complaint, which is not a complaint really at all. And now we are fully staffed and it's all part of the wider picture. I'm thinking that it might be a good idea for all councillors to have a webinar when it would maybe fit in with something else as well about the work of the complaints team, so everybody actually has a wider understanding of the work that's done and how you can, as a councillor, work with that team as well.
Thank you. I'd like to reply to that, Chair, if that's okay.
Yes.
And absolutely, the scrutiny for place was really positive, and I would echo that the role that the councillors play is fantastically helpful, sometimes unsung, and I'd certainly relish an opportunity to work more closely. And going back to Councillor Wolf's comments earlier, sometimes people don't know what to ask in the heat of the moment, but if there's any reflective questions, I'm more than happy to field them after the meeting. My only slight concern would be if a councillor has diverted a formal complaint, we still need to learn from that. And I think the formal process does enable matters to be heard. It enables complainants to have their complaint considered and ultimately meet a resolution. And if things are informally resolved, that's brilliant, but we need to not lose the positive outcome of that and any learning or actions that we need to take because we've resolved things. Sometimes the hard work starts after the matter's been responded to.
Yes,
that is brilliant. Okay, we haven't got any more questions coming in, I don't think. Just quick zoom down the chat bar.
I think that most people have left by the looks of the Chair.
I'm afraid we are losing people at the moment, but I think we've still got most of the committee on the line. Okay, the recommendation on that paper is to note the report. So I think we note the report and thank you very much for coming today. And as you suggested, if there's any more comments, go directly back to our officers. But thank you very much for coming. And if I can move on to the next item, item 8, which is performance scrutiny. Do we have David Bonner here? Good afternoon, David. Apologies for being a bit late. You're probably used to being late for my meetings, aren't you?
Not at all, Chair, not at all. So, well, hello everyone.
Very, very polite. You're going to put on a request soon to come on first, aren't you? I can see this coming.
Shuffling of the agenda. So good afternoon, committee, and thank you for having the performance report today. So my name is David Bonner, Service Manager for Business Intelligence and Performance. In time-honoured fashion, we have a slightly different approach to performance reporting. We don't have a traditional report. We have an online dashboard which is made available to the Scrutiny Committee and the public. So I'm going to share my screen now, which hopefully will work. Okay. It's thinking hard. Okay, looks like it's doing something. Right, hopefully people can see that now, and hopefully you can still hear me. People on my screen have frozen, but hopefully I'm presenting the dashboard. So, Chair, I don't know if you could just confirm that you can hear me.
I can hear you, David. It's Molly.
Thank you very much, Councillor Rennie. Okay, so members of the committee have had an opportunity to have a look at the dashboard and discuss as a group which items you would like to bring to the attention of the meeting today and scrutinise. So I will start by moving us on to the monthly update page, which is shown here. At the moment, this is currently filtered to show all of the items which are flagging as red in our performance system for the council. So as I mentioned a moment ago, committee have had an opportunity to have a look at this already. Chair, I don't know if you can hear me, but would you like to direct me to any particular items? No, okay. I think we have a technical glitch at the moment, in which case I will start to walk through some of the items that have been previously flagged as something that we might like to look at today. So first off, there is some good news. If I just move on to our operational adults and children's drafts, some of the committee flagged in a previous meeting some concerns around the individuals who felt safer as a result of a safeguarding intervention. So if I just scroll down a little bit here. Right, so we can see that earlier in the year a conversation was had around some of the statistics around individuals that felt safer as a result of the safeguarding intervention being somewhat below where we would like them to be. So the orange line is the target, that's where we would like to be, and the light blue bar is this year's performance. So although we were performing slightly better this year than last year, it still wasn't quite where we needed to be, and the committee wanted to have a look at that. The good news is in the latest quarterly reporting, we are now hitting our target for the number of individuals that felt safer as a result of their safeguarding intervention. So there's a little bit of good news in there, and that can be taken in line with this metric here, individuals that felt listened to during the safeguarding intervention. Again, earlier in the year, the committee flagged a little bit of a concern around some of the results we were seeing there. I'm pleased to confirm for the last 2 quarters we have been hitting the target for those figures. Chair, I think are things working again now?
Yes, yeah.
Excellent. Okay.
Okay, I've got a couple of questions on this. This is we are on the adult and housing performance charts, are we?
We are.
We are. The first 3 of them, AD, O1, O2 and O2, actually particularly O2 hasn't got any targets on, and I think some targets onto there would be really useful. If officers could have a look at that for me.
Yep.
Okay. Is this the one with freedom of information requests on?
I can move to the freedom of information requests as our next metric.
Okay, that was where my concerns were.
So we've got freedom of information requests in the Children's Directorate being answered on time. At the moment, you can see again the light blue bars over the previous reporting periods between committees has been below target and is currently below target. So that's just that. 69.23% of requests are answered on time at the moment. If we drill through into the detail, it's currently flagging as a red metric. The direction of travel is also negative, and there's some commentary in there to support what's happening with that. Chair, I don't know if you'd like to make any further comments.
I wonder if we could just have a briefing note back on that, because it has been low for so long and it's not improving.
Okay.
A briefing note for the next, either to go around to the committee or for the next agenda. I don't want people there to present or anything else. Just a briefing note as a explanation as to what is being done on that one. I've got Bill Pipe wanting to come in. Sorry, Councillor Pipe, would you like to come in?
Yep, thank you, Chairman. It's always a pleasure to be able to read a report from David Bonner, no doubt aided very efficiently by Bridget Downton. They're always well composed and presented, but as you've already picked up, you know, I did have concerns about the FOIs on the children's services. Are you talking to Councillor Parry on this, David?
Yes, Councillor Pipe. Yep. So Councillor Perry will be aware of these issues. I don't know if I think Councillor Perry is still on the line, but this is something that we do bring up at a monthly meeting with Councillor Parry, so it does get discussed. So he is aware of it, and I believe that some activity so this is in relation to freedom of information, but we also have some concerns around. I just scroll down here, subject access requests, which are also below where they need to be at the moment. It's a similar territory. And we do have some actions in here at the moment. So 2 full-time members of staff have been transferred across the information compliance team to try and ease some of these pressures. And the target date for that was today. So I will be finding out whether or not that's happened. But certainly the intention is that will ease some of the backlog in some of these responses. That's obviously from a subject access requests perspective, but I understand similar conversations are going on around what we could do to help with the freedom of information requests as well.
Okay, Mark Eyre.
Sorry, yeah, could I just come in there? I've got Mark Eyre who's asking to come in.
Excellent.
And
Good.
respond on the FOIs, because he's taken a piece of work to Place and Resources Scrutiny Committee. Are you there,
Chair.
Mark?
Yeah, I certainly am.
Thank you, brilliant. Thank you.
Chair, and thanks committee. So I'm Mark Eyre, I'm the Service Manager for Assurance. So the information compliance team, which sort of facilitate the process of freedom of information and subject access requests, is part of my service. If I pick up first of all around the freedom of information requests, what the report that we sent through to the Place and Resources Scrutiny Committee that they received last week set out the overall performance of Dorset Council, which was actually for the first time for some time was showing as green. So we've got some pockets across the authority where the compliance levels are slightly lower than others, but we are seeing a general improvement. If I pick up on the particular issue around children's, there's a bit of work that we're doing around freedom of information, which is to try and analyse what the regular requests are that come through and try and understand whether in some cases some of that information may be better off more transparently made available from the outset, thus removing the need for freedom of information requests at all, or certainly to be able to direct people to that bit of key information. In terms of the subject access requests, that's actually, in terms of compliance, that's actually been an issue for quite some time. Part of the issue is, I mean, if we go back to when the General Data Protection Regulations came in, since that point of time, the number of subject access requests have actually doubled. Now, those sort of requests, this is basically where somebody is asking for any information that is held about them. They can be very significant in terms of the size of documents that need to be released, and because of the sensitive nature, they can require a lot of redaction to be undertaken by a number of people. So if I give a bit of an example, one of the requests we had last year had sort of 13,000 plus pages and was approximately 440 hours of work. So the vast majority of the subject access requests sit within children's services. The bit of work we've been doing with children's is looking at how we best manage this process moving forward. And as David alluded to in terms of the commentary, the team that currently deal with SARS are going to move out of children's as of tomorrow, actually, into the information compliance team. So they're working more closely with other officers dealing with similar types of work, and we'll use that as an opportunity to look at how we can hopefully make the process more efficient. The other bit that we're looking at on top of that is that we've only got so much internal capacity to deal with that redaction work. So on top of the internal delivery, we've also been trialing some outsource work with a company that specialises in redaction and can actually, certainly as it stands at the moment, provide some of that service at more efficiently than we can internally. So we're looking moving forward at a bit of a hybrid of internal and outsourced delivery of SARS. It's not going to be a quick fix, if I'm being completely honest with you. We do have a bit of a backlog in terms of some of that SARS, but I'm positive that that new approach will, over time, provide us in a far better position than what we're currently reporting. I hope that I'm conscious I've waffled on a little bit there, Chair, but hopefully that helps to provide a bit of background.
No, that is helpful. Councillor Pipe?
Yeah, it's very helpful. Is there anything that Andrew Parry, if he's still with us, would like to add to that? I'd be interested to hear. If not, then I'm absolutely satisfied with what David and Mark has provided, and well done all. If Councillor Parry's there, great. If not to worry.
No. Oh, yes. Would you like to come in, Councillor Parry?
Very happy to. Is there something specifically that Councillor Pipe wants me to pick up on?
You're on mute, Councillor Pipe.
I beg your pardon, Chairman. It's just the progress today. I know you've come to an arrangement on the second point, but on the point of FOI, all the phones are ringing.
Sorry.
Is there anything you want to say on that? I'm going to mute. Mute.
There's nothing specific I would like to add today on this, but I'll be very happy to discuss with officers post this meeting. I don't know if Sarah Jane has something she wishes to comment on.
Thank you, Councillor Parry. Nothing extra to add other than what's been said already, but we'll come back with the progress report.
Okay, thank you. Thank you very much. The only thing on this, I really don't want to duplicate what is being done on place and resources. So I'll have a conversation with Councillor Bartlett just to make sure that we're not expecting officers to report the same thing to two committees. Did you want to come in, Councillor Rennie?
Yes, I've found what I wanted to ask now, and I'm glad that Andrew's here. He might be able to help us. I did mention that earlier on about the number of families in bed and breakfast more than 6 months, but I think we're going to have to go. Andrew Billany's had to leave, so I think we'll have to deal with that out of the meeting. But I'm concerned about because we don't have the figures for children and average number of working days lost for staffing sickness until we start on the 1st of July 2021. But the number of days lost to sickness within children's services has been consistently red. That's long-term sickness, and we got to December this past year as we move forward, and then it went into red again for a lot of short-term sickness. Two of the different bars have got short-term sickness. Now, if we are going to sustain our good in Ofsted, the two things to me go together, and long-term sickness sometimes can just be one person that can take you into red. I'm well aware of that, and I'm well aware of the pressures that everybody's working under at the moment, but it does concern me to see this solid block of red within children's on the RAG ratings. Oh, and actually David's pulled them up on something else as well, because I'm looking on my other computer. So thank you.
Would you like to come in, David?
Thank you, Chair. If I may just pick up on Molly's point there. There have been instances of both long-term sickness and certain employees with some quite, and I have to say some of those are very, very significant matters, and they are somewhat unavoidable. Where I think we must have a focus, of course, is in health and well-being of our staff teams. And if there's signs of perhaps some feeling the strain of what has been a very difficult period of time coping with the pandemic and various lockdown restrictions and everything else, then we need to look at that as well. Changes in government guidelines around isolation periods will probably have some impact on the figures that we will see. I would expect that to be the case as well. But yeah, it has been, we're not getting away from that. It has been an incredibly challenging period of time, and some staff really have felt the pressures of that. And so we would look to see what we can do there, and perhaps separately from this, I'll have a conversation with the director team to see if there are any particular hotspots. I know a few years ago, for example, in the travel team, there was a particular cohort, particular group of staff there who were averaging, twice the average number of days across the rest of the council at the time. And with a bit of development and health and wellbeing guidance, we managed to reduce those sickness days. So I'd be looking to do something similar here if there was an established pattern, but there have been some quite extraordinary random matters as well, I have to say.
Thank you. Because as well, this morning earlier on in the meeting, well, the very first items, we were dealing again with this health and well-being and the impacts of COVID as well on our caring section. And a lot of people who work in children's are in exactly that same position. And I just wanted us to, as you're going to be talking to Ofsted again in April, I just think it's really important that we keep an eye on that now as a committee too, and offer any help that we can give in any way.
Sarah?
Thank you, Chair. And Councillor Parry, Chair, if I could just come in there, and Councillor Rennie, just to offer some information to build really on what Councillor Parry said. Absolutely. We have a really keen eye to make sure that we're supporting all of our staff, and there are some very individual circumstances here. But it's tough work in children's services. It really is, as Councillor Rennie's just recognised, and our staff have done amazingly well throughout all of this, but we are really alert to their health and well-being, and working with colleagues in HR and OD to really think hard about how we continue that conversation with staff, how we're right alongside them, we listen to them as to what they think would be helpful. And Teresa runs workshops as well with staff to hear directly from them as to what would be helpful. So we'll continue with that, and we'll continue feeding that information also back into these reports. I hope that's helpful.
Thank you. Yes, thank you.
Okay, can I just come in on that? There was a couple of metrics on foster carers, the number of foster carers being consistently low, and also the out of Dorset foster placements. Can I ask Sarah, we've got a paper on fostering coming at the next committee. Could this be picked up within that paper and a comment on that, please? Yeah, I know we're doing a lot of work on foster carers, but it's not good to be putting young people out of county. I think one of the other things I would like to pick up on is on the HR performance charts, and that is around the really high staff turnover in public health, which I'm not quite sure how the metrics are done, whether they're done by year or what they're done by, but there seems to be quite a high turnover of staff in there, and I wonder whether we could have some comment back on that, whether it is an issue or whether it's just an annual report on that.
Okay, so it's a rolling, I believe it's a rolling 12-month average, Councillor Taylor, but I will find out. If we, forgive me, if we go back onto the current list of exceptions, I believe it's flagged as a red this month, so let's just have a look.
Okay.
Oh, for God's sake.
No, it doesn't appear to be flagged as a red on this particular dashboard. However, you're quite correct. It is much higher than the other directorates at the moment. we go back onto the graph I was on previously. So the orange line is public health, and it's consistently high.
Yeah. Okay, and
it's 12-month rolling data. Yeah.
Yes, it is, isn't it? And just another comment, we've had a lot of discussion about care sufficiency, and we haven't got an awful lot of metrics on that. I'm just wondering, because of the significance of it, whether we could have some metrics in on it so we can monitor it a little bit easier than keeping having to go back for reports.
Can certainly look into that for you, Chair.
Okay,
Yes.
that would be super. Councillor Taylor, would you like to come in?
Yeah, thank you, Chair. That's very, very interesting reports, actually, because I was going on to the guys what Molly just said, is the fact that children's services, foster care, are they being watched carefully? Because there is an awful lot of stuff going on out there which we're not aware of. And sorry about the expletive earlier. My husband tripped over his cat. I do apologise. But that's the question, because I think the reports they're there, but they're not in depth enough for me to quite understand exactly where we are and how we can achieve better status, because there is room for improvement, massive room for improvement, and especially as I'm involved with foster care, to see where we're going forward to, actually.
So I understand, Councillor Taylor, that your next scrutiny session, there will be a report on that. Is that correct, Chair? I think that's one of the items that was previously flagged. So
yeah.
Yeah, it's just a concern, because I think we seem to be static and not going forward, and that does concern me.
And that's why we need to bring it forward for a paper next time, or to include it in the fostering service paper. I've got Councillor Wharf and Steve Evers, I think, are coming back on my comments about metrics for carers.
Yeah, excuse me, my voice is going. Thank you, Chair. Yes, it's an extremely good point, and we found since developing this tool that it is a constantly growing and changing tool to recognise the metrics that are currently important. And so, yes, I'll be working with them. This tool has been going for some time now, and I did hear your questions earlier, and it is something that all portfolio holders have reference to and can review on a monthly basis. So there is no reason why they shouldn't be aware of any of the issues there. But specifically, I'll follow up the sufficiencies metrics. Thank you.
Thank you very much appreciated. Did you want to add anything to that, Steve?
Thank you, Councillor Taylor. No, I was actually going to come back on the public health metric. Not make a supposition. So knowing my own data fairly well, I have a large, circa 350 full-time equivalent workforce, which is why when our turnover looks relatively low, for public health, they have a very small staff complement. I think off the top of my head, it's something like 15 to 18 members of staff. One or two individuals leaving in a year will push you well over that sort of 10, 15, 20%. I presume it's because it's averages or percentages of the total turnover that may well have taken it over. That would only take less than a handful of staff to leave from public health for that to be a fairly high percentage of the total public health workforce.
Okay, David, can you take that away to give it some thought, because that's the sort of thing that, it's the difference between percentage and actual numbers, isn't it?
I certainly can, Chair. Yes, and Steve's absolutely right. It's coming from a much smaller base number. It is, and it's flagged as amber at the moment, and it is something that is being raised as a concern. But I will certainly go away and have a look, see if there's some value maybe in presenting the numbers slightly differently, so we don't have that issue. Because you're right, it's hard to make a comparison across very large directorates and slightly smaller ones.
Okay, are there any more questions on the dashboard? I haven't got any more RTSs into the chat bar at the moment, so I'm going to assume there aren't any more questions. And thank you very much for the help and all the time you're spending on this. I think we're starting to get it embedded, but I think we've still got quite a way to go. So thank you very much.
It's a
And
pleasure.
I'll see you in a couple of months' time.
Thank you. Thanks, everyone.
Right, next on the agenda, where are we? Do apologise. Scrutiny requests. Right, we've had one scrutiny request come in from a member of the public. we are looking at that at the moment. It is very much tied in with the care sufficiency and also the oh gosh, I've forgotten the name of it. The assessments that are being done on the cost of care across Dorset at the moment and nationally. So I'd like to just hold that scrutiny request at the moment until we've got more information about the benchmarking on the cost of care, and then I'll come back and present and look at where we're going to go with it as a result of that. So that is the scrutiny requests. I will be reporting back on that. If we can go on to the committee and cabinet forward plans. We've got another fairly full agenda for March. And then we've started to populate the May agenda. If you've got any scrutiny requests you'd like to put in, either from this committee or anybody from across the council, please feel free to do so. I think the interesting one for me is going to be the ICB setup next month or in March, because as we go forward into that, I think we need to be quite clear what our role from health scrutiny will be within that. Just for members' information, the ICS doesn't specifically mention health scrutiny and where this sits going forward. So this is something I personally want to get very nailed so we know exactly what we're doing and what's being expected of us going forward. We've also got 3 working groups up and running at the moment. I've had an update on the registered providers one. Questions should be going out to registered providers next week, certainly to the 3 main ones that we want to pull in and interview. The rough sleeper working group will be up and running later this year. And we also have a working group on the reports that have to be done from health, the annual reports. The annual report should be coming out about middle of the summer, later on in the autumn. So at the moment, we don't have any of those outstanding. If I can move on to the cabinet forward plan. Once again, which I think I nearly always say, we need to get as much information into the 4-month plan as we can so that we can, as members of this committee, have a chance to look at what's coming up and what we would like to look at. I was quite concerned about the ROC, where I can find it, the reducing repeat removals of children into care. And I've got Councillor Rennie has put her hand up. Councillor Rennie?
Yes, thank you. I now know what your comment meant. Yes, following this decision at Cabinet to bring forward this, it's a pause project, it's called, which I'm very supportive of anyway. It's to do with children being taken into care and more than one child in a family where people have continued pregnancies. I did a little bit of digging into this because I didn't know where this is. It had not been to a scrutiny or an overview committee, but I've since had a phone call from Andrew Parry. I don't know if Andrew's still here, and Andrew wants to set up a working group with more people with an interest and an understanding of this subject. Oh, I'm glad Andrew's still here. So Andrew has contacted me because I spoke with Graham Carr-Jones as well, because it comes into the community safety area as well as the work of the council.
Thank you, Chair. If I may just comment very briefly. Yes, its route to Cabinet was via the Health and Wellbeing Board, and it certainly raised through Health and Wellbeing, from my understanding. I will.
No, it didn't. It wasn't on an agenda there either.
I will check that. But certainly, Molly and I, Councillor Rennie and I, have had discussions, and it will sit with, in terms of lead member responsibilities, it will sit with Andrew Kirby, working with Molly and also, as she's rightly said, Graham Carr-Jones through the Community Safety Partnership, because there is a bigger piece of work that this can go on to develop, as well as just being from the primary reason, which is obviously to reduce the number of children coming into care.
Okay, this working group, what is it being set up under? Is that going to be under overview or under us?
Sorry, I would see this as being a matter for overview.
Okay.
Establishment of policy.
Okay, and if we need to do any work on it longer term, Councillor Rennie?
It is a joint piece of work as well, because it's partially funded through health as well. And of course, their process is different to our process as well regarding commissioning of services.
Okay. Can I bring Councillor Wharf in? Is this on the same subject or?
Thank you, Chair. It's on the previous subject that you related to ICB. I rang Patricia Miller, the new Chief Executive, to wish her well, and we had a short discussion. It was very short, but I expressed my concerns about the potentially overlapping and confusing responsibilities of the new ICB, ICS, Health and Wellbeing Boards and the People and Health Committees. And she acknowledged that there was a degree of confusion as to who was responsible for that, what, and this was one of the first things she was going to look at. She doesn't get appointed just yet, but I did say as soon as she did, could she come and talk to me? And I'd be very happy to receive any input from yourself, or hopefully just an agreement that there is potential for confusion between those various bodies. Thanks, Chair.
I think you're right. There is huge potential for confusion, and I find it interesting that across the country, an awful lot of health and wellbeing, sorry, not health and wellbeing, health scrutiny committees have already got information about how they're going to go forward. So it's actually, I was quite relieved when the ICS was delayed for a few months, which gives us a little bit more breathing space to sort out the relationships. Okay, I've got Councillor Ireland wishing to come in.
Yeah, thank you, Chairman. This is sort of tenuously related to our forward plan, I guess. It's just that I couldn't find another way of actually mentioning this in the meeting without, because we don't have an AOB. We obviously have a new Chief Executive, Dorset County, coming into post. I believe it's Siobhan Harrington, who's moved from the Whittington. But for your information and the information of members, the Chief Exec of Dorset Healthcare has got a new job and will be leaving early summer, is what we were told last week. He's moving to Bristol, so we'll have a new Chief Exec in place there at some point.
Okay. Thank you. Have we got anything else that we need to discuss on the forward plan? Is there anything that members would like to look at in a longer term, as in post decision making? Right, I don't have anybody coming in. So we've looked at the committee and the cabinet forward plans. I have no urgent items and I've got no exempt business, so I'd like to call an end to this meeting at 13:37, please. Thank you very much, everybody.